Hey guys, Mike Linares here with SimpleNursing.com, and I'm super excited to announce that we're doing a big collaboration with nurses that you know, like, and trust from Instagram, TikTok, and we're here with some pretty powerful guests. So we're gonna be talking everything nursing and everything you wanna know about the future of nursing.
Hey guys, I'm Barbara. You guys can find me at Your Nursing Educator on Instagram.
Hi guys, my name is Rachel Santana. My handle is at XOXO Santana. You guys can find me on Instagram or on TikTok. And I also have a YouTube channel. It's just Rachel Santana, where I post like my day in the life as a nurse.
Hey guys, my name is Tamina, and you can find me at tamina.rn on both Instagram and TikTok.
All right guys, so we're gonna be talking today about things that you wish you would have known as a nurse. So all you guys are working in the field. Tamina is the brand new nurse. How many months now?
7 months.
7 months.
Yeah.
In ICU, you go girl.
Okay, and then how many months have you, or years? You were the COVID nurse. You started when COVID happened. Okay.
So
wow.
2.5 years, almost 3 years.
Okay, and then you're the most seasoned here, 4 years?
I'm the most seasoned, but it's only been like 4.5 years, but.
Okay. So
that's
what
so awesome.
America and Canada wants to know, what pissed you off so much? I guess like the one thing that pissed you off the most, or something you would change as a new grad. What didn't you know? What gave you the most anxiety? And whoever wants to take it, we can talk.
I think for me, it was just the fact that you never knew what you were walking into as a
Okay,
new grad
that's
nurse. Nursing is unlike any job because it's not like you have a schedule of this is gonna happen at this time, this is gonna happen at this time. You could be walking into your shift and it's a complete mess.
Yeah,
And
it's a
there's just
show.
people running around everywhere. And it's just completely unexpected and you can never plan ahead. So I think as a new grad, it's just so stressful not knowing what
Not
you're
being
walking
organized,
into.
yeah.
The
And then-
organization is
And then
most stressful.
you work on the med-surg floor, so it's like all your meds are scheduled at a certain time. You give insulin, you give antibiotics, and then if someone codes, your whole day is a train
The whole
wreck.
day is
Yeah.
a train wreck.
Is that what you experienced as well when you
Yeah,
were?
I mean always, and like it's not even if your patient codes, at least like on the floor that I worked on, or usually floors, like there'll be like a paper at the beginning of the shift and it'll have everybody's name and everybody's assignment, and then it'll be like Rachel is for example CPR 1, and then you're a CPR 2, and then you're the medication nurse, and then you're the runner.
Really?
So and then somebody's recording. Yeah, so if there's a code, it doesn't matter whose code it is, everybody has to stop what they're doing and go help.
Yeah.
Oh.
So like you're in the middle of something and you have to run and stop what you're doing, so it kind of messes up everybody's day.
Okay.
Not messes up, I don't want to say, because nobody chooses
just-
to
It throws it
go
off.
into
Takes
cardiac
up
arrest.
extra time.
Yeah.
Yeah, same thing in the ICU, like, because you're like code med or code blue for other floors.
Really? So you have to
So you
leave your
hear
patient.
like code med and you're like, oh, I'm covering that floor. So you have to leave your patients in the ICU, whatever's happening, and you have to go up there.
Yeah.
So that takes time. Or randomly in the ICU, they'll be like, oh, I want this patient to have an MRI, like randomly. And you're like, oh, this patient's sedation, it's gonna take like 3 hours. I have another patient, and that throws your day off. Or they're like, oh, we need a CT, and then that throws your day off.
How was it like, okay, so how was it really kind of settling into your role of finding out that fluidity of, because when you come out of nursing school, you only know the basics of the books and pharmacology barely. How long did it take you to feel like comfortable and like, okay, here's my patients, and then a train wreck happens? Do you even feel comfortable like yet?
Honestly, and I always thought about that. Like I remember my first day working as a nurse, I was like, oh, like when am I gonna feel comfortable? Like how many months is it gonna take for me to feel comfortable? Like I can't picture that even happening. Like I feel so stressed, whatever. And then it's just repetition, day by day, trial and error. Like you start learning, and then after a month, I was like, okay, you know what? I'm good on my own. Like I don't need a preceptor.
Okay.
And then things would happen and be like, oh my God, I'll call the preceptor.
Where's my
Like, oh my God,
preceptor?
where is she? What do I do? And like you learn as you go. It took me, I think I would say like 6 months. After like 6 months,
Okay.
which is now you're like at 7 months, I'm sure you feel
Yeah.
super independent. That's when I started feeling
didn't
super
say all that.
independent.
No, I'm just kidding.
But like you do kind of, right?
Yeah, I feel more independent. I think what I learned in the ICU is like you just have to keep going. You don't have a choice but to keep going.
Yeah.
So I accepted that. Once you accept it, it gets easier.
That's true.
So the 6-month mark, you were kicked out of, well, not kicked out of, but they ended your preceptorship. Most nursing preceptorships, if you guys are considering that, is around 4 months.
In the ICU, it was 4 months.
Okay, and then did you even feel ready after, like, you don't have you're flying solo now?
I didn't feel ready, but I was just like, I guess I know enough.
Oh man.
So I just did it, and I just asked a lot of questions.
Okay.
In the beginning, I would have anxiety coming in because I'm like, what am I gonna get? What's gonna happen? Like, I don't know anything. And then I just learned to accept that, like, I'm not gonna know what's gonna happen. And you just keep going. You just act as things happen.
So that's really good.
That's the biggest
because
tip I can give.
A lot of new grads, it's just kind of like the NCLEX, kind of like nursing school. Before you do anything new,
Yeah.
a lot of new grads out there, probably you guys are considering, what don't I don't know about this unit I just got hired onto? Any tips? So ask questions is a great tip.
Ask questions, work with your team.
Yes.
Okay.
You know, always help people. If it's within your scope of practice to help somebody, then go for it. Like, maybe I don't know everything about a medication. I've only been a nurse for 2 months. Maybe I'm still learning, but if somebody needs help cleaning a patient or changing a patient,
Yes.
I can help them.
Okay.
Especially if I'm helping a more experienced nurse. The next time I'm stuck on a medication, or I don't know how to give plasma, or I don't know how to give blood, they're gonna help me. You know what I mean?
Okay.
I feel like it's teamwork, and that for me is like always helped me when I'm drowning.
And jump in on new opportunities. So if you're like for
Yes.
example, I keep referencing the ICU. If something's happening next door, I've never done a trach or a peg,
yeah.
I'm like, okay, I need to go in there, and I ask, I'm like, do you guys need help? Can I help? If they don't need help, I'm like, can I just watch real quick because I've never experienced this,
do that too.
and that's how you learn.
So you guys are talking about, before we started shooting, a funny experience about pegs, and new nurses don't really know. You have to turn off a valve.
Yes.
What happens if you don't turn off that valve?
If you don't, it's like a weird thing. It's like an off switch, and you can switch it, and it takes a while to figure it out. And then if you're gonna give a med and you forget to turn it towards the patient, so the medication goes towards the patient, and you're just like, oh, this is so hard, and you just go for it. All the meds are gonna fall in your face.
Oh, man.
Hasn't happened to me.
It has
but
happened to me.
It's happened to you.
Yeah.
Stop. It's happened to
And
you.
I remember in orientation, my preceptor told me, this is gonna happen, it happened to everyone. I was like, not me, I'm gonna remember. This is never gonna happen to me.
Yeah.
And it happened to me right in front of the patient's family member.
Oh,
On both me and the patient, and I was like, oh man. Yeah, it happens, it's okay, it's normal.
it's okay.
That's kind of similar to when you're hanging antibiotics
I
and
know,
you
I
forget
was
to
just gonna
unclamp
mention
the saline lock, and you're like, oh,
then,
why
like-
are my antibiotics
And then
running?
like 3
Yeah.
hours go by, and the patient's like, can you disconnect it? Because I don't need it. And you're like, you haven't even ran it, and you're like,
Yeah.
actually you need it like a little longer, and then you like unclamp it, put it really quick, like, yeah, like just for like a little bit, like 30 minutes, like,
Yeah.
I
definitely
know, I've
has
done that
happened to me.
before. The funniest thing is when you hang, for me at least, when I was hanging like little piggybacks, antibiotics, and you
Yeah.
don't forget to turn it off,
Exactly.
and,
Oh,
and it's like
yes.
spills all over you, you're like, crap.
Yeah.
When
that
you just
happens.
pull it,
Yeah.
like
and
when you
then-
just like don't realize that you already spiked it, and you just pull it, and all the meds over the floor, and then the whole room smells like Zosyn, like
Yeah,
smells
exactly.
Yeah.
like
Nasty.
super strong.
But I find that it's these situations where like you do it once and then you will never do
Remember,
it again.
You'll never forget it.
you struggle and you have to clean it up, and it messes up your whole day. You're like, I will never forget. That's how you learn.
That's how you
Yeah,
learn, as a
exactly.
nurse.
It
Yeah.
is, yeah.
Learn as you go.
Okay, other than getting squirted in the face with what, peg tube juice or
Ew.
or like antibiotic stuff, was there any other times you guys just felt that our new nurses are watching? Any tips that can prevent them or from looking like an idiot, or basically looking experienced, or tips and
No.
tricks, hacks?
I think that honestly the best thing you can do is just like don't be ashamed of anything.
Okay.
You're there to do a job, an amazing job, to help people, to care for somebody's family member, and at the end of the day, those people are not going to judge you. They're grateful that you're taking care of them, and that's how you have to feel. You know, every once in a while you're going to get a patient's family and a patient that's like, you know, in a bad mood or uptight or whatever, it's gonna give you attitude. You just have to push through that because you're doing a service to them and you're helping them out. And like, it's okay to make mistakes. Everybody's human.
Yeah, of
You know,
course.
nobody's perfect. And if anything, you know, always just apologize. Apologize if you do something wrong, ask for forgiveness, do the best you could do. But unfortunately, I think the best way to learn is making mistakes.
Yeah,
That's what's
yeah, you
good.
just got to do it and
Yeah.
then learn from it. Yeah,
100%.
as long as it's not huge, of course.
Yes.
Patient safety.
I would say pause and think. Sometimes
Yeah.
we're like, oh, I have to give all these
Right.
meds, I have to do this. But like, if you have questions or concerns, pause
Mm-hmm.
and think about what you're doing. Ask questions, even if it's dumb. Just
Yeah.
be like, hey, I'm doing this. This does seem right to you. Like, what's going on?
Yeah.
That way it also prevents mistakes.
It's funny because my preceptor, I was working in the ER, and I was a tech for like 5 years. And I was like, oh, all nurses do, because you know, techs, if you guys didn't know, that they do casting, they do everything except needles and drugs.
Yeah.
So I just thought like, oh, nurses, they just do needles and drugs. And then I was like, oh, snap. There's a lot that goes into it. So one of my preceptors, one of the biggest tips, if you guys are watching, they were saying that if you're in a rush, go slow. Because if you're in a rush and you make stupid mistakes, silly mistakes, like one time we talked about this in an interview yesterday, where I almost gave 22 of IV push labetalol instead of 2.2. I know. It was a good thing my preceptor caught
Down
me.
goes that heart rate.
And down goes my license, yeah, for sure. So yeah, those are really big, you know,
Oh, no.
rushing mistakes. Yeah.
I have like a thing I thought of.
Okay,
It hasn't
yeah.
happened to me, but I started working in the cath lab. So there we give like Neo, which is
Neomycin?
phenylephrine.
Oh, okay.
So, you know, that's to everything up.
Yeah.
Everything up?
Everything
Okay.
up. I think of like everything up, like blood pressure up. If a patient's
Yeah.
drowning, you put them
Yeah,
on a
yeah.
Neo drip. We call it Neo. So it's in a vial, and it has to be reconstituted into a 250 ml bag.
Okay.
So you're supposed to draw it up and then put it in the 250 bag and then start it. A nurse like didn't know that it had to be reconstituted and drew up the whole vial
And just pushed it in.
pushed it
Oh, no, what
like
the heck?
mid-procedure, because the doctor was like, oh, start neo. And like the nurse was new and they didn't know. And they're like, okay, so push neo. Okay, so they pushed the whole thing. And all of a sudden he's doing the procedure. It was like cardiac cath. And the patient's blood pressure starts going up, 200, 300,
200?
200, 300. And the doctor's like, what? How much neo did you give? And he's, oh, the whole thing. And like, thankfully, like the doctor caught it early on. They were able to like reverse it. And it was able to,
Dang,
they were able
stabilize
to fix.
it.
And like they told me that story and I was like scarred from that story. And like now I
Yes.
know like you never push.
It's
neo.
those types of stories that it's like, oh snap.
Or like if you're
Just
new,
ask questions.
That's what
Yeah.
just ask.
if the nurse would have just asked the doctor, even if they would
Exactly.
have given him attitude or
Even if
whatever,
it's a dumb
like
question, right?
even if they think it's dumb, like
Yeah.
it's not dumb. Like I
Right.
always ask and I'm like, whatever, at least nothing bad happened.
Mm-hmm.
Like, oh, how much do you want me to give? What do I start the drip at? I'm not just gonna go for it. You
Yeah, speak
know?
up, yeah.
When you're
Double
learning.
check too.
Double
And
check.
I'll always
Triple
ask,
check.
I'm like, hey, I know this is a dumb question,
Yeah.
but because at the end of the day, it's someone's life.
Yeah.
At the
And
same
it's my
time,
license, so it's okay. I'd rather look dumb in front of you than make a huge mistake.
especially with the nursing shortage, there's like no experienced nurses. They're only traveling nurses now. And I'm not saying that there's like no staff nurses. That's the majority are just new. So they're gonna expect you guys to be new, and so we can just say, hey, I'm new. This might be a dumb question, but
Yeah.
ask the question, kind of thing.
The one thing I found for myself as a new grad is I have this personality where I want to do everything and make it look like I know everything.
Right.
And so I had a lot of difficulty just taking on too much and not asking for help from my coworkers who knew what they're doing, just because I didn't want it to make it look like I was drowning and like I wasn't a good new grad nurse. I wouldn't do that. So if you're a new grad, just ask for help because it's going to kind of screw you over in the long run, and you're more likely to make mistakes and have like higher stress situations.
Yeah, you're putting
if you
so
just take on too much.
Putting so much anxiety you don't even need. You do it to
Yeah,
yourself.
exactly. You're
You don't-
self-sabotaging.
Yeah, you don't need to.
Delegate.
It's always delegate, and like we were talking about in the beginning of this conversation, the whole code thing, how everybody has to help out. At the end of the day, like whether it's your patient or not your patient, you're working on that floor as a nurse, so it's everybody's patient.
everyone's patient.
If something goes wrong, so like if you're walking by, you know, and the patient asks you for something, don't be like, I'll get your nurse, and like leave. Like if you're not busy, obviously be like, okay, what do you need? Sometimes it's something so simple, it's like water, a blanket, like a med, or a question, and then you're like, okay, your nurse is busy. Let me see if I could help you. Like I've given drugs for my coworkers plenty of times.
Yeah.
Like I'll go because they're busy or they're in an emergency situation, and that's what I would want somebody to do for me.
Yeah, of course. And I mean, a lot of the new grads probably watching this or going to be new grads have grew up in the COVID society of nursing, and it's all your clinicals are online, and you probably only had maybe one simulation of an actual patient. That's
crazy.
And then
was
it's,
Are you? That was you.
And then I started in ICU with no ICU experience.
oh my
I didn't even know what it was like to be in ICU. I never had clinical in ICU. I shot my shot, got the job, and I was like, all right. On the first day, I was like, I don't know.
Let's do
So she didn't even put her hands on a patient since first semester. It was like a year and a half. She graduated to the NCLEX, and then the second time
wow.
she
You're
was.
killing it. You're killing it.
I know.
I would never.
And I was like, I don't even remember how like pull up the drugs. I don't even remember how like prime the IV. Like I didn't remember anything.
Yeah,
It
no
was
Foley's,
insane, but
no
I just
IV,
like
no, yeah.
just went in and I just did it.
Yeah, you had no option.
I had no option. Yeah, it was.
You got to learn before you earn. So yeah, and that's what I tell new grads all the time, is that you're a guest in someone's house. You're a sponge. They obviously know you don't know anything, and especially in the post-COVID world, all the new staff nurses are new grads, possibly. And so one of the biggest things is that nursing school doesn't prepare you for is being fluid with your team. And showing you how to help out with multiple different beds,
Yes.
rather than you have one patient, one thing, you know.
I
And
agree
so-
with that. And like another thing, I feel like nobody likes a know-it-all. So like if you come in as like the new grad, doesn't know anything, you're like, don't worry, I know how to do it. Don't worry, I know how to do it. Like it doesn't come off it doesn't come off very nice.
Yeah.
There's always something new to learn. I'm like 3 years in and I feel like I learn something new literally every single day. Every single day I learn something new. So like just keep always asking for help, always learning. I'm not just gonna be like, oh well, I did an NG tube one time at clinical, so I could do this one. Like if it's my first time doing it as an official nurse, like every time it's my first time, I call like a more experienced nurse.
Right.
And I'm like,
Yes.
can you watch me do this? Or like maybe I could watch you, but like I just want somebody to guide me.
Yeah.
I don't want to make a mistake.
Of course, yeah.
You know?
Those
So,
are the best kind of nurses.
No, yeah,
Yeah.
it's true.
when you ask for help, don't be ashamed.
And at the same time, I frame it like this, where it's like, you're a brand new baby nurse. And There's nurses that have been there for 15 years, probably 20 years.
And they still learn something new every day.
Yeah, and they're like more than half your age. And the thing is that when you're a cocky nurse or think you know it all with like the most updated book or like, you know, you have the book textbook idea, then it just comes off rude because this is like their home, you're a guest in their home, and you don't want to give that first impression.
And a lot of time,
Oh, sorry.
No, I'm sorry. A lot of the time, textbook stuff doesn't align with real life. Like expectations, reality is completely different. So a lot of time, the book will tell you this is the best thing to do, and then you get an experienced nurse, and she's like, Coca-Cola through the peg, that's gonna unclog it. I know because I know, and you're like, okay, and then you see it, and you're like, wow, like amazing, save so much time.
It's
just
like your
asking.
grandmother's recipe. It's like, wait, what? Like,
Exactly. Yeah.
it's so true.
And sometimes it's just hospital policy is different from what you learned in school, and it could be completely different. So don't just go in there and think you know it all.
No, never.
How did you guys stay organized? You told me about your nurse brain.
Brain sheets,
Brain
yeah.
sheets. Do you use the same brain sheets?
So cool.
I just write everything I need to know on the one sheet about every patient, so that if for whatever reason something comes up, I have all of their info like in my pocket.
Cool.
So that's always on me. But
Is that what you used when you were a new grad? Like, what organized you? How did you like?
I had
just crap ton of patients, and you're like, oh no.
Yeah, I would get like 3 to 4 patients,
Okay.
and like step down, and like luckily my unit that I worked on had like a report sheet,
Okay.
and the report sheet was the best because it had like the diagnosis of the patient,
Okay.
the history, like their medication schedule. Like it'll be like
Ooh.
IV and drip, so you can write like, oh, they have a left AC, it was put the 20th, so it's the 24th, so it needs a new IV. So you write like the day it was placed.
Okay.
So it had like everything literally important you need to know. If they had any lines and the last dressing change of the line, so you don't fall back. So everything on that paper, and it was very detailed. So since I got lucky that I got trained like that, so that stuck with me. Now when I go to a new place, I like copy that report sheet. Like I
Okay.
made copies of it and I made my own.
Okay.
And that's how I stay up to date.
Nice. Okay. Do they do the same thing in ICU?
Yeah, so we have a report sheet on my unit too, and it's the neuro ICU, so it's really like neuro-based, but it has all the systems. So I always like grab a sticker, so I have all of their information, and I put that on the sheet, and then it goes from like why they're here, like the diagnosis, the history, and then it goes systemic. It goes cardiac, renal, all of the systems, and then we have the meds, the IVs, the drips. And now it's stuck with me too. I have a copy. I'm like, if I ever leave or anything happens, like this is perfect because it has everything you need to know. So I always I have the report sheet. So as they're giving report, I look at the patient systemically too. I look at their blood pressure, I look at everything that's going on to make sure it lines up with the report they're giving me. Or I see it, they're like, oh yeah, they're being sinus tach, and I'm like, how high did it go? And I like look at the monitor, and it's like 120. I'm like, did you guys do anything about it? Is it okay? Is it normal for this patient?
Yeah.
You know, so like as you get the report sheet, also like pay attention, look at the patient, because it could be complete opposite, you know? And typically most patients code during report. You know what I mean? When people are giving report.
No one's watching.
No one's watching them.
Yeah, exactly. Yeah, so that's why it's so important to do it at bedside. Make sure everything they're telling you actually lines up with how the patient's looking.
You mentioned something really interesting. It's like assess your patient, not the sheets.
Yes.
Or not the labs.
Yeah.
That's very interesting.
I learned that in school, and like I always thought it was so dumb because it was always like the #1 test question.
Right.
Assess.
Look at the
And it's like,
patient.
whatever, mom. Like,
It was like-
and it's like, oh crap, that's what they're telling me.
Always like the answer was like treat the patient, not the monitor.
Yeah.
Okay.
And like always thought that was so dumb. And when I started in the real world, I realized that that's like it is the #1 thing.
Yes.
Like, oh my God, the patient's not connected. That's
Yeah.
why they're not in asystole. They're not connected to the monitor.
Yeah.
You look over and like it'll say that the patient's in asystole. The patient took all the leads off. They're on the floor and they're like on their phone like texting.
Yeah.
Like always assess the patient. Don't freak out. Check on the patient first, and also that everybody's different. So like my baseline could be 40 heart rate and yours is 60, and that's
Right.
fine. But I'm good sinus Brady. I'm good. So just always everybody's different and treat the patient.
Fair. All right, so some key takeaways for the new grads. Be willing to help out. Don't act like you know everything. Just tell them you're new and just be like, hey, I'm new and I don't know, so just double check me. Have your brain sheets filled out and assess the patient rather than the machines.
Yeah.
Cool.
Yeah.
All right, so if there was one thing you would change about nursing today, what would it be?
The pay.
Oh, dang, okay, watch out.
That makes a huge difference.
The pay solves all the other
Put it right
problems.
for it.
Because if you pay right, there's no short staff. Then
Okay.
nurses have support. They don't have to get burned out.
Yeah, how is it that hospitals are not paying the staff as much as travelers, and then all of a sudden a traveler comes in, like, yeah, I'll just pay you, 3x.
I don't know how that's working.
I just I don't think there's a nursing shortage. There is not a
No,
nursing shortage.
That's why it's so hard to
just-
get into nursing school.
Okay.
And it's so hard
Yeah.
to stay in nursing school because there's a lot of nurses. There's a
Okay.
shortage at bedside.
And
okay.
they don't want to pay us. They don't want
Yeah.
to pay. So like I saw like I think it was like on TikTok or somebody posted like, oh, I'm a nurse with like 10 years of experience. I'm like CCRN. I have ICU. I have travel. I have everything. And this hospital offered me $2,700 $27 an hour. What a
$27
slap in the
an
face.
hour, yeah.
Like literally a slap in the face. Like you don't even value me. And it's like, that's it. And guess what? That nurse didn't take the job. So
Of
guess
course.
what? One less nurse. And how many times does that happen? And that's why there's such a shortage. And these hospital CEOs are making a lot more. Like they can obviously afford it, but they just don't want to. So.
Okay, that makes sense.
And I think for a really long time, they got away with it. And this is the
Yeah.
first time ever that people are speaking out against it.
No, it's true. Yeah.
And they're demanding what nurses deserve, because nurses deserve so much more.
Yeah, I mean, I think COVID just showed how, the backbone of the hospital is nurses.
The back
Yes.
And like, I don't know if you guys know, but 60 to sometimes 80% of the hospital is actual nursing. So if nurses leave, you kind of just don't have any hospital. You can have a lot of doctors, but who's going to set up for surgery? Who's going to work like, the OR, ICU, ER? Because, nurses are there for 12 hours and doctors come in, can go, do all the orders, but the people actually doing the work are the nurses.
Yeah.
Okay, so you guys are nurses in the United States. So Georgia and Florida, Miami, Atlanta. You are only Canadian nurse. Is it the same in terms of being underpaid or undervalued as a nurse?
From where I'm from, we have a union.
Okay.
And so they have a set up payment schedule.
Like
so,
guidelines, yeah.
Yeah.
Okay.
So during year 1, you're making X amount. In year 2, you're making X amount.
Okay.
And I don't really think I can,
Yeah. Is there-
really, there's no wiggle room.
Are the hospitals the same pay across Canada or in your area?
It might be different with
Okay.
other hospitals, but if you're with a union, which a lot of the hospitals in Toronto are, you're just getting this
The same flat rate.
Same
Okay.
flat rate pay. You get a little bit of a premium if you're working a night shift or if you're in charge overnight or if you're working a weekend. But it's not like it's a lot of money. It's like $30 an hour for someone who's been there 4 or 5 years. The max you can make an hour after working 25 years is, I think, around $50 an hour.
No
Canadian.
way. Canadian.
So that converted to
still-
US is like $40 an
No.
hour for like the maximum
Oh,
amount
man.
of years at a hospital.
Come on down. The water's
Wait,
fine.
Yeah.
so
We work over
is there
here.
like travel nursing in Canada? Or?
Well, you know what? We were just saying that
Yeah.
I think there are some travel nursing, but it like Canadians come down to the US.
Okay.
I don't really think there's much in Canada other than if you're going up to the rural areas, which is a lot because it's like one
Okay.
nurse in the entire hospital and you do
Yeah.
like
You're like
everything.
in the middle of like nowhere.
And you're in the middle of like a snowstorm.
yeah.
Jeez.
Yeah.
I heard of
I
a lot
personally couldn't do that.
I heard of a lot
It's
of Philippine nurses come and then they go to Canada because no one wants to work those jobs.
Yeah.
They get their experience, then come down to the U.S.
Yeah.
No way.
Yeah. I actually met, it's funny, side story here. We were supposed to, okay, so all these influencers are here, these lovely ladies are down in Los Angeles. It's beautiful weather. I'm like, hey, let's go for tacos last night. And everyone cancels and I go for tacos by myself. I know.
Sorry.
Okay,
You
sorry.
hanging.
Long story short, I go to get some tacos and tequila. And then I'm sitting next to a Canadian nurse who's a travel nurse, works in the ER.
So cool.
And my specialty was ER for 5 years. And she was telling the same thing. And she was like, yeah, then they cap nurses at a certain pay. I came down here. I'm making more in 10 weeks than I would in 10 months.
It's wild.
And I'm like, well, she's like, it takes 2 months of all the logistics and paperwork, but it's like, it's so worth it. I don't have to work for the next 9 months if I don't want to.
Yeah.
I'm like, wow.
That's amazing.
It is, yeah.
I mean, I never got to do travel. Like I was gonna do it, and then I just didn't do it because
You
like
still
my
can.
family. I know.
Oh, okay.
My family.
It doesn't work
my-
out for everyone.
It doesn't
That's
work
right,
out for
yeah.
everybody. I wanted to like say, and like I was like, oh, will it really be that much of a difference? 'Cause
Mm-hmm.
I make all this money, but then I have to pay rent. I have to find somewhere to live. I'm gonna be by myself. I have to get a car. Like it's so much to figure out.
Yeah.
And
but-
like-
okay, so Tamina was telling me that
Local travel.
there's a nurse that travels only 50 miles from her home
Cool.
and makes 3x what she's making?
Yeah, like, so she
Amazing.
makes, in 1 week, she makes what I make in a month.
Oh, man.
So her working 3 days is what I make an entire month.
Yeah. And so she drives 50
Pre-tax.
miles. Drives back.
Yeah. And she just drives 50 minutes.
Yeah.
No traffic.
So you don't
It's
have to leave home,
amazing.
yeah.
And there's also like seasonal nurses, which is you cut out the middleman and you negotiate with the hospital yourself. You can be a local traveler, but you don't have to pay a portion out
Cool.
to the agency, so you get paid more yourself, and they are paying less technically because the agencies are taking out a lot of money too.
So I don't know if you guys knew this, but agents, so nurses are getting paid a lot, like 4, 5, 6,000 a week, but the agencies usually take 50%, in a sense that they're making just as much as the nurse.
Right. So it's like 5,000 to the agency, 5,000
5,000 to
the
you,
nurse.
yeah.
Which is
And
also
so
mind blowing.
that is crazy.
wild.
Because
I
they
know.
could just offer a bit more to the nurses.
To the
They'll
staff
stay as
nurses.
staff and they will save so much money, but they
Right?
don't want to.
Yeah.
They don't want to.
That's
Because
crazy.
they think it's like temporary, and it's like it's not temporary.
Nurses are
I
not.
know.
It's been a shortage.
Nursing is not going to go back to what it used to be.
Ever.
Yeah.
People won't accept that. So it's very interesting to see where it's gonna go. They either have to pay up or travel nursing is just gonna be the new thing.
That's fair.
Yeah.
Okay, so other than the pay, let's just say the pay was golden. Everyone got paid nursing, travel nursing pay. Is there something to be said about not just the money, but also the culture and kind of like the mission of the hospital and how you're treated as a nurse in general hospitals? In terms of your break times, your staffing, given equipment?
So I used to work on a unit. There was no union, no nothing. And it was like, get a break when you get a break and like figure it out.
Okay.
And like sometimes like you don't eat and that's like normal. And like, I don't know why that's normalized because that's not normal. And like when I'm giving a report, I'm like, oh, I was so busy last night, I didn't even eat. And the day shift nurse is like, girl, I never eat. And I was like, that's like not normal. Like, you shouldn't be proud of that. Like that's not good.
Yeah.
Red flag, not good for your mental health, like not eating. And I remember one time my old boss, she was like, yeah, so like we're super short staffed. So like if you guys can just like while you guys are on break, like call patient family members to update them on their conditions.
Oh my God.
It's not a break. That's
It's
not a
your-
break.
It's not your break, yeah.
That's not a break. I was like, is she kidding? She must be kidding.
You must
She's
work on your
insane.
time off, yeah, or like your break.
So yeah, so girl, so let's do something. Instead of you going home and going to sleep tonight, why don't you stay and call the patient family members since you're such an advocate, and we can do our job as a nurse and take our legal break.
Yeah, exactly.
And I feel like this is common,
Yeah,
at least in the
super.
States. In Canada, like I have it good with the
Super.
union and everything, but I feel like a lot of my followers on Instagram are like, I don't ever get a break. I can barely go pee. I don't eat during my shift. And I'm like,
Sheesh.
That was me
no
too.
good.
That was me too. And in the ICU, you have to have at least 2 people watching your patients when you leave, at least in my hospital. So there was one point I just got for orientation and I was just running around like trying to figure out what to do and all of that. And then I almost passed out because I didn't eat anything all
Oh,
day.
man, your blood sugar.
And
you're
literally
tiny.
I had to pause. And at that point, she took my patient to MRI and I was waiting for the MRI to be done. And I was like, I'm gonna pass out like right now. Like I didn't eat all day. I've been so stressed out, didn't have any water. And then the MRI nurse gave me her celery and like peanut butter.
Peanut butter too. Oh my
And it saved me. And then after that, first thing I do in the morning is I pack my pockets with snacks.
Shut up.
I'm like, just in case. And then I prioritize it. I'm like, life or death, get everything I did. And I'm like, everything else can just wait 30 minutes, 15 minutes minimum.
Right.
I have to go eat. Like,
Yeah,
I have to.
yeah.
Then I can't be a good nurse if I don't have any, like, if I don't
Right.
have
If
food
you
in
don't
my
take care of
system.
yourself, yeah.
So I started doing that. I'm like, okay, can this wait like 30 minutes? And once I reach that point, I'm like, hey, are you going to lunch? Can I go real quick? And then like have them watch my patients, go to lunch and like come back.
You guys are like on an amazing race, like survival.
No,
It's like,
literally,
yeah.
it really is.
You go in there, it's like survival mode, and at the end, and that's why it's like physically, mentally, and emotionally draining.
Exhausting, draining and exhausting.
good.
So
Yeah.
draining.
Which I don't know how the new grad nurses, like I don't know how anyone lasts in bedside for 20, 30 years,
That amazes me
especially with
too.
how it is right now.
That's a long
Yeah.
time.
No.
And like that's why I left bedside. That's why I don't work bedside anymore. That's why I work in the cath lab, and it's so much better. Now in the cath lab, I'm like living my best life.
One patient,
for you.
one at a time.
Yeah, I am. I highly recommend it. Cath lab is the way to go. Literally, you guys, one patient at a time.
Okay. Keep it going. Oh, that
And
sounds
then
good.
you kind of like work with the doctor, like the surgeon, and like your whole team, like your techs would be like, okay, so we have 2 more cases left. Can we do lunch now? Like you take lunch as a team.
Wow.
And like it's supposed to be 30 minutes, but you're allowed like a 15-minute breakfast and like a 30-minute break. So
Breakfast?
Dang.
Yeah.
What?
Never heard of that.
yeah.
Mind blowing.
You're supposed to have like a 15-minute breakfast and then like a 30-minute lunch. So like they're like, okay, let's just combine it, and you guys can, if you don't have your breakfast, you can have a 45-minute lunch.
What?
And like it's like no phone, no problem, no drama. Because I remember when I worked on the floor, it was like 30 minutes, and like if somebody calls in those 30 minutes, like your break's over. Like you have to go. Like my patient has to go to the bathroom in those 30 minutes. Like nobody's gonna help them. You have to
No.
go.
Really?
Yeah.
They cut your
Like-
break short?
Yeah, like always. Like, oh, I'll be like, they'll call me and they're like, Rachel, what are you doing? I'm eating. This is my lunch break. Oh, okay. Well, your patient's med is due, or pharmacy's here to deliver like your Keppra. I'm like,
They can't sign for it?
I'm like, can you just? See, it depends who you're working with. If you're nice and stuff, they're gonna be like, okay, I signed exactly.
is everything.
I signed for it. But if you're working, if you get floated to another floor, and for some reason those people are like, you know, and they don't like you, then they'll be like, no, you can come get it. Like I'm not signing for you. It's an important med, and you're like, you have to stop and like go. So
What's it like to be floated to another floor?
it's horrible.
Are you like a stepchild in someone else's home?
Yeah,
Is it
it's, like, horrible.
You, you don't know
Yeah.
anything? Is that?
It's like I feel like it's 80%. It's like being a travel nurse almost. It's like
Okay.
80% of the time, it's like no one's gonna help you, and you're screwed. You're gonna get the worst assignment.
Oh no.
And like another percent is like maybe you get some good people and they're nice to you.
Okay.
And then when you float to that floor again, they remember you.
Okay.
But like, you know, but like I feel like half the time that you get floated, it's like a nightmare. I hate getting floated.
Well, it's just like everyone who works there just clicks together and like
And you
kinda
don't.
leaves
You're the
you
you're the
behind.
loner. Yeah.
See, I didn't experience that culture because
Yeah.
I've never got floated because we're so short-staffed.
Oh,
They need us.
Okay.
Yeah, they need us.
Yeah.
And then when I started off, 80% of it was like staff, and now it's 20% staff and 80% travel nurse. So everyone helps each other because everyone's new. So like the toxic culture, I haven't experienced it because everyone is like, we're just helping each other. We're like in desperate mode.
Yeah.
Yeah.
But like I prefer that
Lifeboat.
because it's like you feel more comfortable, and when you're feeling more comfortable, you're less likely to make mistakes.
Yes.
As opposed to like being under pressure and like, oh, I have to do this and I have to do it by myself and I have to figure it out, and like you're YouTubing how to put it in yourself. Like,
God.
you know, like I can't imagine that. Like I've seen people do that.
Really?
I've done that too, yeah.
Girl, just ask for help.
You YouTube
Yeah,
a
but if you
skill
don't-
or what?
No, because sometimes
YouTubing is skill.
when
Oh
stuff
my
goes
God.
down and there's no one to help, and I'm like, I have to do this right now. Like, let me see if I
Yeah.
can figure it out. And then if I can't, I'm like, whenever you get a chance, I know you're like trying to save this life right now, but like in like 30 minutes, can you help?
Can you help me do my skills, my basic skills I'm trying
Yeah,
to
please
get?
and thank you.
Because I'm a post-COVID nurse.
Yeah.
Yeah.
Yeah, it's hard.
I feel like though the longer that you're a nurse, the more like chill you are. Like
Okay.
like you're not ashamed. Like I saw this super funny TikTok, and it was like me like as a new grad, like when the patient asked me for a med, like low key googling it on my phone so I don't see, and then like me like 5 years later as a nurse, when the patient asked me a question, like me googling it like right in front of their face, like
It's
savage,
like,
like
whatever,
it
yeah.
is what it is. Like, I'm doing my best, like you know, and that's how it is.
Okay, so yeah, that makes sense. Though no shame in the game.
No shame.
You don't know what you don't know, right? So just
Yeah.
look it up. So I guess another question is say you get floated to the floor, are there any tips and tricks of how to be liked by the people you don't know and you're working with? I always tell students, you know, you're going onto a clinical unit or you're a new grad, bring like some cookies, bring something for the staff. So
Oh,
it's
yeah.
like, oh, you're the cookie nurse. Oh, we like you.
Yeah,
I have a question.
Yeah,
Sorry, that
okay.
goes with that.
What?
Does it matter if they like you? Like, do you really want to go in there and be liked, or can you survive without having to please them?
That's a
is my
really-
question for you guys as a new grad nurse.
Not necessarily that you want to be liked, but you just want to have some helping hands if something
If
happens,
something
right?
Yeah.
goes crappy.
Yeah.
yeah,
you
like
need
I'm
some
not trying to bribe anybody for sure.
Yeah.
But like you know, like you wanna be nice. You wanna get along with
The
people.
friendly neighbor, yeah.
Yeah, you wanna be like the friendly neighbor. I did that when it was like my first day. I brought everybody like Cuban food. Like I brought like croquetas.
Oh, you're so nice.
I did on my first day. I brought croquetas and I brought pastelitos and like cortadito, and I brought it for everybody, like coffee, like little pastries. And it was like my first day, and they appreciated that. And then when it was Nurses Week, I did something like that too, because I was new. Like I started in March, and then May I was already like 2 months, and everybody like appreciated that, so they remembered.
Yeah.
And like it's like a nice thing.
Yeah.
So I would say, yeah, it does help. But like what doesn't help is like now, like with social media, they'll be like, ugh. Like some people be like, oh my god, I
'cause
follow.
they know
Yeah,
you.
yeah. They'll be like, some people be like, oh my god, I follow you. Like, oh my god, you're the best. Like,
I know.
take a picture. Like, I'll help you out, whatever. And then some people will be like, ugh, that's a TikTok nurse.
Yeah, it's like she's all into himself.
She
it's like,
doesn't
no,
do anything. Like just like
Oh.
a stigma. It's definitely a stigma.
Yeah.
So at the end of the day, like to like answer your question, like I think it doesn't really matter. Like you have to just go in and do what you need to do and like forget everybody else. Because at the end of the day, everybody's gonna have like everybody, I feel like when you first meet somebody, you have like a perception of that person.
Yeah.
And it's
that's so
always
true.
it's never gonna go away no matter what they do.
Yeah.
So some people like you and they're gonna like you, and if they don't, they don't.
Yeah, I mean, at least you can do the gesture.
And like
of
just exactly.
yeah.
And like just also like just stay true to yourself. And I feel like when you're yourself and you're authentic, people are gonna like you. Like
Yeah.
nobody likes to try hard or like a liar.
And I find if you're being floated up to a floor, just offer your help. At least show them, like, hey, I'm willing to help you guys out, so that they know that you're there to help them out. And then if something happens and you need assistance with whatever it may be, they have your back too.
Yeah, because
Yeah.
I heard a lot that preceptors are like, you know, you get a float from another unit. It's like, you're going to drag my time down because you don't know where anything's at.
No.
And you're the newbie here, and it's like, I already am overworked. And it's like, oh. So just go in there smiling, bringing cookies, like, okay, well, you're trying. You know?
Yeah.
Well, I'm trying.
Yeah,
Yeah,
you're
I'm doing
trying.
my best. Like I'll always do that. I'll be like, or they'll ask me for something. I always like, even now with my new job, they'll be like, Rachel, I need this. Oh, can you get it for me? Do you know where it is? I'm like, I don't know where it is, but I'll figure it out. And like, I'll figure it out. And like, I'll run out of the room and I'll find out. Be like, hey, where's this? Where's this? Show me. And then like, yeah, because like you're trying to help, and it's like they appreciate the effort.
You want to adventure?
You know?
Or the explorer?
Oh, I'm running. I run around. I'm like with my little Hoka shoes. I run around everywhere always, trying to be fast.
Okay.
And that goes a long way.
It does.
Yeah.
People appreciate effort. You know?
Yeah, I agree.
All right, so let's just say that tomorrow they make every nursing pay very adequate and the same. Probably not as much as traveling. I don't know how sustainable that is, but at the same time, you are feeling appreciated in the pay. In the pay. What's the number one thing, or what's the certain thing that you look for going into a new hospital? Just because a lot of new grads out there, it's just like nursing school. You just want to get accepted. You don't even know anything about that nursing school. And then when you get in, you find out, oh my gosh, this place isn't organized. It's crap. The teachers are mean. So I guess for new grads out there, what is something that you would look for other than pay? Like in an actual, like, I guess what's a quality thing?
I think the people that you work with make a huge difference, because the job is a job. And like being a nurse, you're gonna be a nurse everywhere. And it's always gonna be the same thing. You're gonna have patients, people are gonna be sick, you're gonna have COVID, you're not gonna have COVID, you're gonna get floated. But like the people that you surround yourself with make or break your shift. Like having a good CP, having a good CNA, having a good coworker that's always by your side. And that was also like, honestly, the reason why I stayed at my last job so long, because I was overworked and I was over bedside, but because I love the people so much and I love my coworkers so much, like I didn't want to leave, because I was like scared that I wouldn't find a home again. Like I was like, oh, what if I start somewhere new and like they don't like me, they don't help me.
How do you make those connections being so new, and how do you get someone to like you in those first?
You help them.
Okay.
Yeah.
Honestly, that's
Feed them and you
like
help them.
like me as a new grad, I'm still doing that constantly. I'm like,
Helping, yeah.
hey, like if I sit down for 5 minutes, I have nothing like going on. I'm like, I just walk around like, hey, do you need help? What's going on with patients? Do you have any procedures today? Can I help you out anyway? Do you need to change or like turn a patient? Like I'm here. The more you help, the more people are like, oh, okay. Even if they're like mean to you, they're like, all right, she helped me. Like next time they look out for you. So I think also the unit culture, like, is it toxic culture or is it like the people? Like, are they nice or they're mean and they have cliques and like they will bully you out of the unit? Thankfully, I haven't experienced that. But also, once again, 80% of my staff are like travelers.
Travelers, everyone's new.
Yeah, but I think like get them to like you by helping them.
Okay.
The more you help them, the more they will help you.
Okay.
Always.
Yeah.
It always
And
goes
even
that way.
just during downtime, just talking about just real life and like,
Yeah.
if you have no patients using their call bells and everyone's okay, just forming an actual relationship with your coworkers is gonna make a huge difference in the
That's-
long run.
That's interesting, because like I've heard two conflicting things where it's like, when you're a new nurse, you want to be kind of quiet in a sense that you don't want to overshare, especially in the first 2 weeks, first impressions. So like, how do you balance the line between, oversharing your personal life and undersharing and who you're talking to?
Don't get personal.
Okay, not yet, or
So
when?
talk about life. At least for me personally, I just started talking about life. Like, hey, did you guys check out this new restaurant in town?
Okay,
Like,
okay,
that's
okay.
cool.
That's a good one.
Nothing deep.
Nothing
Yeah.
deep. Or, if they
Check out
ask
my
me like,
TikToks, like,
oh, yeah, like I don't even bring up social media. I'm like, oh, whatever, Yeah, so
Keep
like,
it hushed.
have small talk. And people
Okay.
enjoy that because you're like stressed out, you get lonely, and it's nice to just like de-stress.
Yeah.
But you don't have to get personal and deep and like talk
Right.
about like your
Yeah.
dating life. I mean, you
Yeah.
can if you want to, but I wouldn't.
Yeah.
Just kind of keep it on the surface. It's
Yeah.
still interesting conversations.
Especially your first few weeks.
Yes.
Yeah.
Or like see how the conversation goes. Like if you always have the same conversation with somebody and then all of a sudden they're like, oh, so like, do you have a boyfriend? You're like, oh, I do. We've been together this long. Like, just like see how it goes and just like let it flow like organically.
Yeah.
And just make friends. I feel like it's a better environment if you work with your friends.
Okay. That's
You know? And like it's easier to learn that way too. Cause like if it's your friend, you're not gonna be ashamed. You're not gonna be scared to ask something. You know what I mean? You're
Yeah,
like,
it's a friend.
"Hey,"
Yeah, it's not like preceptor.
yeah, exactly. I've never done this before. Can you help me? They're like, oh yeah, I learned the other day.
Yeah,
You know?
they always say that.
Really?
They're
Yeah,
always
I just
learning.
And everyone started in the exact same position. It's not like these people just magically know everything.
No.
We all started at square one and learned our way to where we are right now. So it's never embarrassing
Never.
No.
to ask anyone.
So you guys have never been like bullied by a senior nurse or a veteran nurse, or
I haven't.
has been a toxic culture? Okay, I'm the only one.
I've only had experiences where like I would get a different preceptor each time because we didn't have as much
Okay.
staff nurses, and like some of the seasonal nurses didn't want an orientee because they're like, oh, you're holding me back.
You're dragging me down.
And then they wouldn't know about it until day of. I'm like, hey, I'm with you today. And they're like, oh my God, like I didn't ask for someone to be here. And I'm just like,
That's so
oh
mean.
man, like this is gonna be so awkward, like to my face. I'm like, oh man, but then I just went above and beyond. At the end, she was like, I was really impressed by you today.
You helped me.
Really?
Yeah, good job. And I was like,
What do you mean by going above and beyond? How would they do that? What did you do?
I just did everything, like everything within my limits, and I
Okay.
would ask questions, and I
Okay.
would be like, "Oh, how do you do this?" Because I learned that every nurse does it differently, and some of them get offended. Like when I was an orientee, if I did it differently than them,
Yeah.
so I'd be like, "Hey, how do you do this? This is how I know how to do it." And she appreciated me asking, and she would show me her way, and I was like, "Oh, okay." And then I would just like do things when I didn't know. I would ask her, but then I would take the initiative of doing it with her supervision instead of being kind of like lazy and like not helping out. You know what I
Yeah.
mean?
I
I'll
think
take the
that's a
initiative.
good point because I feel like as a new grad, or if you're starting off with a preceptor, don't just go and ask the questions without trying to like think of the answer yourself or trying to find the answer yourself.
fair.
It shows that you're a little bit lazy. You just want like a quick
Yeah.
help. If you go and show them and say, hey, I learned it this way, or I looked this up and it says this, can you just confirm with me or show me how you do it? And I think that shows a lot to your preceptor that like, hey, I'm trying.
Yeah.
Right?
Instead of, I mean, you said it correctly in a sense that your preceptor, if you're floated to a different preceptor, or let's just say you have a aggressive preceptor that doesn't really want you there. They don't want, it's like having like a 2-year-old, Mom, why is this? Mom, why is that?
Yes.
It's like, oh gosh.
Yes.
So,
Taking
yeah.
the initiative of like doing it and like
researching
kind of
it,
figuring
yeah.
out yourself, but
Confirming
also
it.
confirming and asking.
Yeah.
Fair.
So like when I would do something and they wouldn't like it, they'd be like, oh, this is not how you do it. And I'm like, oh, can you show me your way? So I wasn't like, oh no, this is fine. Like I've learned it this way. People do this all the time.
Yeah.
Instead of doing that, I let them just show me their way. You know what I mean? Because I feel like some people are like kind of overconfident and they're like, oh, I've seen nurses do this like plenty of time. This also works. But instead I'm like, show me your way. I want to learn your way too. And it also helps me.
Yeah, because everyone has a different style. of doing
Yeah.
the same
And they
thing.
appreciate that too. So,
Okay, yeah, that's cool.
And also, like, if you do get different preceptors or, you know, because, like, every nurse has their way and you have to find your way. You know what I mean? So, like, you'll see other people do certain things and, like, it's better to try all the ways. So then you find the best
find your
way.
way.
The easiest way for
Okay.
you.
Yeah, of course.
So,
yeah. It's
that's
not one size fits all. So yeah.
No, definitely not one size fits all.
Okay, so other than forming friendships and kind of getting that culture and that vibe of a family in your unit, anything else that people should look for in like a good home in terms of a hospital? Maybe an educational hospital that you can learn, or
Oh, I said that
That's what you
yesterday.
said yesterday, yeah.
A teaching hospital. I think teaching hospitals are great.
like
That's
university hospital. How do they know? They can Google it. Is it a teaching hospital? Or how did you know?
I always like look it up. Yeah, I knew.
I think they say on their website that
Yeah,
they're, like
Yeah,
if
somewhere
you're
that they're
applying to a
Like,
teaching hospital, you
Yeah.
will know because they are
they
very
advertise
proud of it.
Like,
yeah,
yeah,
they
we're
do.
teaching.
Magna Home.
You do get paid less, but
What?
your experience is, in my
Your
opinion,
experience is worth more.
better.
Is worth more.
In the beginning, yeah.
Even like if small things or their mistakes, they're nicer because oh, this is a teaching hospital. I have to take a moment and teach it to them. You know what I mean? I had a moment like that where I made like a mistake while being in orientation, and then the provider like was totally okay with it doing like in front of family members, and then pulled me to the side later, and they're like, I know this is a teaching hospital, so we're gonna go over this, and kind of like went
Oh,
over
wow.
everything
That's
with
really
me.
nice.
And I was just so thankful that I was working in a teaching hospital and I
Yeah.
didn't just get like yelled at.
Yeah.
Yeah, I
Which
know.
happens too, but
It
that's
happens
like
a lot. Yeah.
a different topic.
Yeah, happens all the time.
Have you guys ever got yelled at by a doctor for them waking them up, or in the middle of the night for something dumb as a new grad?
I've never. So like, luckily, like when I used to work night shift,
Okay.
in bedside, there's like this thing's called like EICU.
What is
so
that?
like, if anything happened, there's like an electronic like ICU that I just like click a button and a camera comes down. They see my patient.
What?
And they give me
No
orders.
way.
Yeah, they did have the easy. That was nice. So that was easy. Or I could just like, I had like my work phone and I could just call like the intensivist that's at the hospital now, like working downstairs, and ask them for orders. So I would always just use that service. Like
Okay.
I would call, be like, hi, I'm Rachel. I'm calling from this floor. I'm calling for the patient in room, whatever, like 4123. Can you please connect me to the doctor? And then they'll be like, okay, where are you calling? And like it'll be like a nurse on the phone, and she'll write down exactly what it is. And I'll be like, oh yeah, I'm calling because I need orders for antibiotics right now. The results came back positive, whatever bacteria, and then they'll be like, okay, and it'll get done. And that's honestly really great.
That's cool.
So I've never gotten yelled at.
You
Have
might-
you
yeah,
guys?
by a doctor.
I haven't, but you also, especially as a new grad, if you're questioning whether you should call the doctor or not, talk to your charge nurse that's on nights and just bounce back. Be like, hey, like, should I call the doctor about
Yeah.
this? What do you think?
Yeah.
Don't just go and take it upon yourself to
Always.
call them about every single little detail,
Yeah.
especially if it's something that can be figured out with you and your team that's present right there. But I've never gotten yelled
Right,
at by
yeah.
a doctor. They're there overnight to help you. They're on call. That's literally,
job.
that's your job.
Yeah, and that's really good because as a new grad, you don't know when to escalate things
Yeah.
and ask a charge nurse. What are some other situations? Like, when did you guys feel it was comfortable for you to be like, I'm uncomfortable and I need to ask a charge nurse or I need to ask a house supervisor?
Well, for
or
me,
something.
also, I would say trust your gut.
Okay.
If you're ever,
Yes.
it always works. Like, if you're ever doing something and you're not sure, you're like, something feels off. Like, I don't know what it is. Like, something feels off. Like, I've never heard of this medication. Like, do I crush it? Do I not? Like, am I supposed to, like, always follow all the steps. And if, like you said, pause and think, I'll pause what I'm doing and I'll use my work phone or whatever. I'll call my cell phone. I'll be like, hey, can you come to my room right now? Like, I'm in this room, like, come help me. And then when they get there, I'll be like, hey, is this fine? And it was always like, I would always call my charge nurse.
Yeah.
Okay.
Like, always call whoever was in charge that night, I would call them. Or if I knew like a more experienced nurse was working the floor that night and I saw them at the computer sitting down, I'd be like, hey, like, is this fine? So always ask and trust your gut.
And it's so awkward for new nurses, I would think, you know, because now you're flying solo. Is there ever a point where it's like, I feel comfortable with this and I don't feel comfortable with these things? Or is it like, I have anxiety about everything, I don't know where my gut is?
I think it's both.
Okay.
So in the beginning, you're like, oh my God, I have anxiety over everything. But then you realize you know more than you think.
Right.
All the basic stuff, like you got it. And then the things that you don't know, like she said, trust your gut. And I didn't understand that in nursing school. They tell you, trust your gut. And I'm like, what does that mean? But you will know, you will have a feeling
You'll
where it's
feel
like,
it.
I'm confused, I don't know, it doesn't feel right.
Yeah.
And you should ask. I always ask the nurses next to me.
Okay.
Because I think the ICU setting may be a little bit different. There's always like, we're like in front of our rooms.
Yeah, it's all
There's
glass.
always like a nurse next to me. So I go, I'm like, hey, what's your opinion? I did this, my patient is this, what would you do? Because I don't really know, I'm a new guy, like I don't know. And then they give me their opinion and then I pause and think about that. And if I agree with it, then I'm like, okay, that sounds right, then I go. And if I don't, then I ask the other nurse just to get a second opinion. And then if things are still like, they don't make sense, I typically go to my provider because we have like mid-level, like NP or PAs, always available.
In the ICU.
Yes.
beautiful
So
thing
I've
about
never reached out to my charge nurse. I'll just go up and like, hey.
Hey, doc.
So
How's it
my
going?
patient, it's always like the NPs
Oh, an
on my
NP,
unit.
okay.
I'm like, hey, so my patient is this and that. Like, what do you want to start? Like, what do you want to do?
Yeah.
You know? And I feel like I'm really spoiled. Not all units have that.
No.
Yeah.
But I always ask. I ask for other people's opinions. First, I go to the nurses next to me. I ask their opinion, and then if I need one more, then I ask another nurse.
Yeah.
And if it still doesn't sit right with me, then I just go to the provider.
That's cool. Like, I worked in the ER and we had like 5 docs all the time. And so you
Be
guys,
nice. Yeah,
you
you guys,
should
Be nice.
you guys are on night shift when you first started, right? And just floating and.
I did both day shifts and night shifts.
Oh, dang.
What do you like better?
I like both.
You like both,
There's
too?
Okay.
pros to both.
Yeah.
I feel like it would be a bit trickier to work. I don't know, sometimes I see the nurses on my floor who are moms and have young kids. And I'm like, how are you here all day long?
Yeah.
Yes.
And your kids, you have to drop off at daycare at whatever, like 5 in the morning.
Yeah.
And then you have to come home and cook dinner. And
Oh my gosh,
a
after
lot.
a 12-hour
It's a
shift.
lot.
It's a lot.
yeah, so I don't mind either of them.
I do both too. Like I started off 1 month on nights, which
Okay.
I love because like I had to learn all my skills.
Yeah.
And then on days and I had to like manage the chaos.
yeah.
Yeah.
So
the
then I
family,
stayed on
yeah.
days, however, but I only pick up shifts on nights.
Okay.
Because I'm like, I can't do this 4 days in a row.
Yeah,
So
4 days
whenever
in-
I want to pick up a shift, I pick it up on night shift.
Why is that?
Because it's less chaotic.
Okay.
Yeah.
okay.
Way less chaotic.
Really?
I mean, it's the same patients, right? They're like still unstable, it's still the ICU, but somehow, even if a patient codes, it goes better on night shift.
Yeah.
Anything that happens is just so smooth.
Why?
It's just smooth on night. I don't know why.
Are the,
It makes-
is this because for me personally, day shift is the old crusty veterans who just been there, have a certain way of doing stuff, and then night shift is the new fun nurses, and everyone's like, you know,
Yeah, like
everyone's like the same boat. Is that
Yeah.
the reason why you think, or?
No, I
No?
don't know. I don't know why. Maybe
Okay.
maybe the providers are more. I don't know. It's just less chaos.
vibe.
For me-
everyone helps out. Maybe
Yeah.
that's why.
Okay.
Everyone's in it together.
Yeah, because on day shift, everyone's like barely surviving. You know, everyone's like running around. They're so busy.
fair.
Like when I get admission on day shift, I know it's gonna suck if you don't have a resource nurse.
Okay.
Yeah.
Because I'm like, oh man, I'm not gonna have help. I'm gonna be running around. But then on night shift, everyone just comes and they help you, and
Yeah.
they just so
Yeah,
smooth.
I totally agree.
Yeah.
I
Agree
like.
with you,
I think that if you're learning, night shift is better because you have a lot more time to
Yeah.
do stuff. You have a lot more time to learn. There's also like no visiting hours at night, so
Okay.
there's that plus. So you don't have the patient's family member at bedside. You have to put a Foley on the patient. You don't have the family member at bedside, like watching you the
Judging
entire
you.
time, judging you. Like
we have
you know?
them 24 hours. There's no limits for us.
For visitors?
also
That's tough.
Wow.
They're always there.
Oh, you guys.
Yeah,
Oh my
so
God.
they're there on nights too, and sometimes they don't sleep. They're just like,
Stop.
and like in the ICU, it's like windows, so like you can see your patient.
Yeah, yeah, yeah.
And then I had like a family member who
Man.
just stood there all night and stared at me, and I'm
No.
like,
Creepy.
We,
No.
Yeah.
we would call them in the ER. We call them the family portrait. So
family portrait?
It's like, yeah, because all of like I worked at 9 different ERs, mostly staffing stuff, and then we would have like the beds go against the walls.
Yeah.
And so when the family's waiting for a doctor's order or like labs to come back or X-rays, like usually the family will like all like the patient's right here, and then like 5 family members will be just looking at the nurse's station. And it's like you just take a picture because it's like they're all
Oh my
lined
God.
up with the patient right there.
Stop. That's so much.
Yeah, you're just like, yeah, they're just like looking at you. Okay, so other than the family, what else?
I think on day shift, there are so many more tests, diagnostic
Yeah.
imaging.
Yeah.
Everything happens on day shift.
It's a lot.
I forgot
It's a
about
lot.
that.
That was
And
the
then
next
all the
question.
blood work results in the morning, so you have to handle the
All the
treatment for that.
Orders are changing constantly.
Wait, what do you mean orders change?
Like they change. Like for example, like I keep referencing the ICU. That's the only experience
Yeah.
I have. But like constantly, they're like, oh, we're not gonna give them the sedation. We're gonna change propofol to fentanyl. And you have to like, I'm like refreshing every 2 seconds in case a new order pops in.
Oh,
and they're major. They're like stat CT like right now.
Yeah.
And I'm
Yeah.
like, oh my god, okay, like I have to like pause everything. I'm like, they put an MRI. Like
Okay.
orders change constantly. Versus on night shift, yeah, you may get it like
Status.
a CT, but like other than that, typically it stays like.
It's usually just if there's an issue that happens overnight.
Yes,
You're
besides
providing
that,
treatment.
yeah, everything that's in the MAR stays in the MAR.
Yeah.
You do the
Okay.
routine stuff. Nothing really like pops out.
All right.
Or like like when, because I worked night shift, I remember we would draw the labs at 5 and then send them through the tube, like the bullet, and then like all the results come back in the morning. So when day shift is coming out of like their little huddle that they do in the morning, and
deal
they're
with all of that.
all the phones are ringing, blowing up, and I'm just like not answering. I'm like, I'm gonna give a report, and it's like, hi, you have a critical, and I'm like, I'm not the nurse anymore, sorry, and like I'm like, here, it's for you, like like they really do they do more
And
work.
that's how they start their day.
And it's horrible. And then you're
man.
just backed up because you got a critical, and you have to replace the potassium. Every hour you have to switch the bag. Then you have to do the feeds because the feeds are like.
See, that's
too
why
much.
I say I'm spoiled because our night shift does at 3 a.m. So by 5 a.m. they get the results, they replace everything.
What?
So you come in, it's like all nice. We're really spoiled, and we have a CT scan on our unit, and we're neuro.
Okay.
So it's like, oh, CT, okay, 2 seconds.
Then
We're like
you move
going
to
in and
a
out.
Oh, that's like really nice.
Very spoiled on my unit.
Okay.
We are,
And like
yeah.
because if your patient is like on a ventilator or anything, then you have to coordinate with RT. Then RT has to
Yes.
come. Then you have to get like 5 people just to take your patient to the CT. Like it's ridiculous. So.
All right, so new grad nurses, if you're listening, write this down. Night shift is probably the way to go, right? You're learning
To start.
to start. Probably for the first 6 months, do you think?
Yeah.
Okay.
year, yeah.
You have less orders, less family, probably more help, younger nurses. They'll probably jive with you better, create
More
a
money.
family.
More money.
Oh, and more money. Okay.
Yeah, that's true.
Get
Ching,
that
ching.
coin.
Higher pay. Period.
Gang, gang, gang.
And night shift becomes like a family because
Always.
you rely on each other,
Yeah.
you know, versus on day shift, like everyone's like, I have to survive. On night shift, it's like, let me help you. Let's help each other. Like
Always.
you talk, and night shift is different.
I love
Yeah.
night shift. But so somebody said this and I remember it's like I rather work day shift. I rather have more downtime in my real life than at work. Cause at work, yes, you have downtime.
Yeah.
Yes, you're chilling. Yes, you're happy. But then you have no life. Like in reality,
What do
you
you
have
mean?
no
I don't get it.
life.
What do you mean?
Because let's say you work 3 days in a row.
Okay.
So I would always put my night shifts together. Like I would stagger them together.
Okay.
Because if you stagger them separately, then you really have no life. So let's say I work night, I sleep in the day. Then let's say Thursday comes around and I clock out of work Thursday morning after working Monday, Tuesday, Wednesday. And it's 9 a.m. and like, yeah, I'm out of work and I'm happy, but I haven't slept.
Yeah.
I'm exhausted. But you don't want to sleep because you're like, oh, it's my day off, whatever. I want to stay up. So you try to like keep yourself awake as long as possible so you can just crash at night. And it never works. You always end up falling asleep at 3 p.m. You sleep and then you wake up at midnight and you're like, what the heck? Like, what am I doing? And then all your days just continue on like that. And then before you know it, when you
Back on
finally,
nights.
yeah, exactly. When you finally have like a decent schedule and it's like 9 a.m. and you're like, yes, I'm starting my day at 9 a.m. It's like, oh, I work tonight. So I need to take a nap because I work tonight. So I can't be up from 9 a.m. to 9 a.m. the next morning, you know?
Yeah, so I started 1 month on night shift, and then I went on day shift, and I've always said that because other new grads in my cohort went on nights, and they are staying on nights, and I just sucked it up, and I was like, I'm gonna do days, like I can do
Yeah.
this, like it's chaos. I hate my life during work, but I love my life outside of work.
Exactly.
Okay, that
And
makes
that's
sense.
what matters more to me. I'm like, I can
Okay.
do anything for 12 hours. It goes
Yeah.
by like this because I'm just running around.
Yeah.
Afterwards, my life outside of work is amazing. And I like don't live to work. I
Work.
Then you have such a good work-life balance.
such a good balance because you actually enjoy your 4 days off.
Yeah.
Yeah.
Versus on night shift, you're always tired, I feel like.
What's
You're always
the
tired.
And I didn't want to age, so I
No
was like,
matter,
I'm not doing that.
yeah. I feel like that aged me too.
Yes,
like, a little bit.
it does.
Like it makes you just
Exhausted.
no sleep, super exhausted, no time for yourself, no time for your family.
How many shifts have you guys stacked together in a row? What's the most?
Oh, one time,
Okay.
I think I did 7 days straight.
7 days. Okay.
7 nights.
I've done
7
5
nights?
days.
Okay.
7. I did
my
7.
God.
My paycheck was, oh,
Yeah.
killer.
Yeah.
Like I
What about
killed
taxes? Taxes takes half of that. No,
I
no.
know.
it. I don't remember, but it was a
Okay.
lot
When it
more.
was
I know, it's
exempt.
one of
Yeah.
those things where it's like, if if you do like 5 days, it's not worth it.
Okay.
I did 5 days and they literally took the entire day that I worked. They took the entire thing. I'm like, why did I show up?
Taxes.
But if you do like the extra 1 or 2 days, then you reach a different tax bracket, and then you get taxed less. So you either really overwork or just work just enough.
Yeah.
I
then
think
it's not worth it.
I think I was just going through something. I think I just had nothing better to do. I was like, I just want to
Make
go to
that
work.
money.
I just want to make this money. Like, I'm stressed. I'm tired. I don't want to be home. I want to do something with my life. And at that point, we're getting like work bonuses. Like, oh, every day that you show up, you get an extra $750.
Damn,
So you would get exactly.
I need to move to Miami.
I know what's going on
What
here.
is going on?
And they don't do it anymore, but they did that.
I feel like they are paying a lot more now because they're so short-staffed.
Yeah.
So even as a new grad, I don't get paid that much. But when I pick up, I make more than I made those 3 days just picking up one shift because they're offering more money because they're so desperate.
That makes sense.
Yeah.
So like, yeah, you get more money. But they didn't offer me $750.
It was a $750 bonus just for showing up to work. Then you get paid.
Oh, and then you actually get paid.
And then
you get paid your
extra.
hourly rate, and then like it'd be overtime money.
Right.
So I would get like night shift, overtime weekend, like the differential.
Adding all that up.
Plus the $750,
Just boom,
and then
boom,
if you
boom.
worked on a COVID unit, which my unit at that time was COVID, so I knew they were gonna leave me there, they were gonna float me. It was $15 an hour extra.
Yeah, during COVID.
So I was like,
heard
I'm
about
gonna
this.
suck it up, and I'm gonna work 7 days straight, and I'll figure it out after. And
Yeah.
Go on vacation after that.
Exactly. Yeah.
Yeah.
They did it to us too. Like they were like super short staff on night shifts. They were like, hey, day shift nurses, if you go on nights, we're gonna pay you extra an hour.
Oh, yeah,
Plus,
night
if you
shift.
pick up, it's extra on top of that. Plus night shift differential. Plus weekend differential. Like I made more in 1 week than I made in a month.
Jeez.
I was
did
like,
too.
sign me up
I did
night
too.
shift. Heck yeah, I'm going. Like,
Okay.
suck it up.
I did.
They don't give you any bonuses as a new grad?
Nothing. I signed a 2-year contract with no bonus.
Oh man. Okay.
I did too. When I was a new grad, my first
This is really
contract,
good.
it was like no sign-on bonus.
What happens if you break your 2-year contract?
You pay.
How much?
So for me personally, my contract is 2 years. If you leave in less than a year, it's $10,000.
Oh, okay.
Which they don't even pay me close to $10,000. So that's like several months of paycheck.
Okay, the reason they do this, if you guys are watching as new grads, it's like, oh man, how could they do this as a hospital? It usually costs 10 to 20 grand to go through the preceptorship program, put all those resources. They just want to make sure that you don't bounce after you do that. So that's the idea.
Which everybody bounces because think about it.
Yeah.
Think about it. Let's say you have to pay 10K, but if you're a travel nurse, you make 6K a week.
Yeah, whatever
You're
it is.
gonna break the contract, pay the money, and then make more money at the end of the
Yeah.
day.
Exactly,
So
yeah.
it's
Yeah. So after 1 year, it's 5,000.
Oh, okay, okay.
But I mean, back in the day, I felt like people were stuck because they like didn't travel and didn't make as much
Yeah.
money,
No
you know.
one
But
makes
nowadays, it's like that's fine. You
Yeah,
don't pay
it's
me
like,
that much, but
whatever.
someone else will. So why would
Yeah.
I take a
would I
huge
say?
pay cut for another year? I hope my job's not watching this.
What's a normal day in the life, and how can you help new grads kind of set up their perfect day?
I feel like for me, like just to make life easier, what helps a lot, like it sounds so simple, but it helps me is like meal prepping and like having your lunch made before and your breakfast before. Yeah. Because like if you have to stop for coffee, that's already you having to stop somewhere.
Okay.
Or like when you get to work, then you have to figure out like who can cover you so you can go have breakfast somewhere. Like always be on time, plan on being there like, 10, 15 minutes ahead of their scheduled time they have to be there. And then have like meals ready because like at least for me, it's like if you have to order something on Uber, I had
Uber
to order
Eats,
on Uber Eats. It's like they don't know how to get to the hospital and they don't know which entrance and you'll tell the Uber person like meet me in front of emergency department. They don't know where it is, they can't find it, and you have to run down. You only have 30 minutes. Like you'll spend more time going to the cafeteria or going to pick something up and that'll waste your whole break time than actually eating. So if you just bring your meal ahead of time.
What do you recommend to like shakes, smoothies, or
Whatever you like.
sandwiches?
It could be a sandwich, it could be burger, fries, whatever. Just meal prep whatever it is that you can and have everything ready before just to make it easily accessible for you.
Okay.
So you have more time to like do your job right.
What's like a normal day in the life of what you do? Like when you get there, you get reports, or do you show up early and look up your patients, or?
So I don't work on the floor anymore.
Okay, when you did, yeah.
When I did, I would get there, I would like have my little lunchbox ready,
Okay.
my coffee or my matcha, whatever I decided to bring that day. Walk in, I would go to huddle. So it was like our break room, like our lounge room.
A huddle, what is that?
We called it huddle. It was like basically like the charge nurse of that shift, the resource nurse of that shift, and our manager, and they were talking and they had a report sheet, and then everybody, and it would be like, okay guys, we have a few announcements today. So our patient in 10 has a family member. We're not allowing family members at the time, but we made an exception because the patient is comfort measures only. They're gonna pass soon.
okay.
So we're allowing them, so that's allowed because it was when COVID times.
Okay.
And then, our patient in 32 is a family member of the nurse that works upstairs, just so you guys know, like, oh, we have a VIP patient, like, they'll know, they'll give us like little tidbits, and like, oh, just so you guys know, our patient in 6 is very delicate and very critical. We wanted an ICU bed for them, but we couldn't get one, so everybody have your eyes on that patient. Like little things like that.
Overview picture.
Like a big overview of like what's happening on the floor, and like, okay guys, hope you have a good shift. Or like, oh, if we have a difficult family member, like, oh, this patient is combative. This patient was disrespectful to the female nurses, so we have to put him with you, Mike. I'm sorry. What? For example, those things happen. But so like the huddle, then after huddle, I would go and I would like write down my assignment on my paper, like my report, like my own personal little paper, and then I have the report sheet. I'll photocopy the report sheet the nurse gives me, so I have my own copy, and the nurse can keep her copy if she comes back in the next day.
You photocopy her brain sheet?
Yeah, no, like the floor will have a report sheet and we'll pass it around. So like, oh, this is the report sheet for 10. Here, I'm going home today. You keep it.
Oh.
So like,
that's really cool.
So what I would do is like I would photocopy it so I don't mess up their paper by writing my little notes on it. You know what I mean? Photocopy it, have it with me, and then get a report from the nurse. And then like always, like as a nurse, like please. Bedside report is annoying, but at least do a report like right next to the bedside, and then go in and see the patient. Don't just take the nurse's word for it, even if it's your bestie. Even if it's your bestie, because that patient could be dead.
Yeah.
Like the patient, or there could be something wrong. They could have pulled their trach out. They could have pulled their peg out, and you haven't seen them. And like you said, like during report is when everybody crashes. And then after that, you go through your shift, and then at the end of the shift, you give a report again, go home. And then like I would like try to like work out or do something to get my mind off things. It's very busy, like watch TikTok, watch Netflix, like anything to like, you know, creative. I think creativity is like a good outlet for me. That's always what has helped me. I like to meditate also. And then I would just go to sleep. That was like a normal day in life.
No, but you mentioned something really critical. I was a tech in the ER, and night shift was giving a report. This seasoned nurse, she was like 15 something years. And then the new LVN was coming on, which is one of the only times LVNs used to work in the hospital. They still kind of do, but grandfather did in California. But she was like, oh yeah, this patient's been chilling. You know, we just are looking at this client's leg because, you know, it has a possible DVT, whatever. And it's like, okay, we're just looking at it. And then the LVN goes in there and actually takes off the covers and finds that the patient's leg's been dangling the whole night.
Stop.
And necrosed, and now they have to amputate it.
See, that could have been prevented.
That's what I'm saying, you know? So never take your reportees, what am I saying? Your reportees nurse? No. Never take the nurse reporting to you their word for it. Always go get your hands on the patient.
Oh, hold on. How about the time this happened? So you know like the rubber band tourniquet that you put to put an IV for the patient?
It was still on?
This was COVID time. So you know in COVID times, you don't go in the room
Unless you have to.
unless you have to.
Okay.
So you get report outside of the room, and then like an hour or two later, you put on your PPE, you go in the room. So I get report, and then like an hour later, I go in the room, and like the nurse was like, "Oh, I placed a new IV, by the way. I did it like at 4." It's like 7.
Okay.
I went into the room at 9 because he told me that everything was fine.
Yeah.
So, and that's what I mean, you learn as you go. I was still a new nurse. So I go into the room, and like usually like, you know, like, I'm sorry, but like we're really busy. Like you don't check all of your patients' IVs. But that day I was like, you know what? I have a feeling like this is COVID. Like there's not a lot of attention to people. Let me just check everything.
Okay.
So like I flushed all the IVs to make sure that they're working properly. And like I look, and when I go to look at that person's IV, it's perfect. And it's giving like blood back. So I'm like, okay, so it gives blood pressure, good. And I moved their gown up, and the tourniquet was still there.
Oh, there was no like blueness or?
It wasn't. It wasn't. But like when I took it off, like it was marked. Like the patient was. It was like a very edemic patient, like +4 pitting edema, like here on the arm. I felt so bad, and the patient was like obtunded on a BiPAP, like basically like just
so they couldn't even say anything.
They couldn't say anything, exactly. So they didn't even notice, and I just felt so bad, and I was like, this is why you get bedside report. Like this is so sad. So always.
It's tricky with COVID times to go at the bedside.
It is. So like it's.
Yeah, you gotta just get your hands on the patient and
as
never
much
take
as you
it.
can. And I was like, what if this was my grandma? I feel so bad if she was just here with the little thing.
But going back to what you were saying, like bedside, some nurses don't want to give bedside. They're like, I'll just do it right here, like this patient.
You mean bedside report?
Yes,
Okay.
a bedside
want to
report.
know.
They're like, oh, this patient's family member's there. They're like, ask a lot of questions. But like as a new grad, and sometimes I feel intimidated to say this, but I do. I'm like, oh, it's okay, that's fine, I'll deal with them. I just really want to do it at bedside. I feel most comfortable doing it at bedside.
And you advocate for yourself, kind of that way.
Yeah,
And the
because in a
patient,
way,
really.
like it's patient safety. So even though if they don't want to, I'm like, I just prefer it that way. Like I make a joke about it. And I'm like, it's fine, I'll deal with them. You're about to leave anyway.
Or just say like, I'm worried about it. Yeah, or I'm new.
Yeah, and that's what I say. And then like I always do it.
Are you
at bedside.
required to do that?
give report at bedside?
We're required, but not
you
everyone.
are.
You know, and
But everyone's like, nah, we go to, yeah.
yeah.
Because then it can get so tricky because you can pick up on something and be like, oh, I don't even know if this is the patient's baseline. And then you don't have any
Exactly.
notes or assessments to look back on to confirm or not. And then you're just basing it off of like, okay, I guess this is their baseline,
Yeah.
maybe not. And at that point,
That's big.
like,
The baseline is
yeah, it's,
because you ask when you're in the room, you see them, and you're like, oh, is this their baseline?
yeah, is this
Like,
how they are? Like, is this their LOC normally?
Yes.
Yeah.
Or it could have just changed half an hour ago, and then you
Yeah.
would have never known, and there wasn't never any note written on it. So,
So you being a med-surg telemetry nurse how does your day look?
fairly similar to Rachel's, but I think when I first started off as a new grad, I came in, like 20, 25 minutes earlier than I was
Okay.
supposed to, just because it gave me peace of mind. I had the time to sit down, read over my patient's chart, and kind of plan out my day to the best that I could. And then when it comes to tele patients, obviously almost everyone's hooked up to the cardiac monitors.
yeah.
So that can sometimes put a wrench in your schedule because things happen.
What do you mean, like it unplugs or?
No. Like someone goes into SVT, someone's
Oh,
going into
yeah.
a third degree, and you're like, oh, I wasn't planning on this happening, but let me go deal with this.
Oh, snap.
And it's nice that they are hooked up to telemetries because I can see right away when something's changing and
Yeah.
deal with it as it's happening.
Wait, so you had to read EKGs or
Yeah.
you guys don't have a telemetry tech or?
That's me.
No way.
I'm the tech.
The nurses
I'm-
do everything. Oh yeah,
Yeah.
there's no CNAs in Canada at the
Or
place
at
she
least
works
at my
There's no
hospital.
techs.
There's no text. I feed
She
them.
does
I change
everything.
them. I do the tele readings.
Who helps you? Nobody?
We
Another
have a unit assistant who will help with the linens and stuff.
Do you guys have like a
But-
resource nurse?
I would
a nurse
die.
who is there just to help everyone out?
No.
Okay.
Wow.
Yeah, so it's a lot. So my
I
day.
appreciate your hospital. No, I'm
Yeah,
joking.
I do.
I said we were spoiled.
Okay.
You guys got
okay,
it
so
good.
your day. Sorry.
So my day, anything can happen at any time because I can see when heart rhythms change, and so
Man, but how do you do that as a new grad? I mean, anyone is still probably having trouble with doing EKGs. Like,
yeah. And so as a new grad on my floor, you have to do the telemetry course.
Okay.
Right? You can't just go into a tele floor
Yeah, of
not
course.
knowing anything about cardiac rhythms. We have to do the course first so that you know how to read the rhythms, how to treat the rhythms, what to do with what rhythm. But yeah, a lot of my time is spent with cardiac patients, and so it's sending them out for tests, going to the cath lab. We send them off to you guys. And I think just as a new grad, on my floor specifically, you kind of really have to learn how to deal with things just popping up out of nowhere because these patients, you see their rhythms change like this, and then dealing with that and learning how to prioritize that situation over another.
Yeah, so prepare to be unprepared with any
Yeah,
changing. Okay.
exactly.
Any hacks or anything other than showing up early and researching your patients? Do you use an EKG card or?
Yeah, I think the telemetry course helped a lot, but I also had a little notebook that I wrote down all my important,
okay.
if it's this rhythm, what do I do? Like with SVT, you can try a vagal maneuver before calling the doctor.
Right.
Like little things like that
Okay.
that you pick up when you're first starting off. Just have that little notebook with you
Makes
so that you
sense.
can refer to it.
Okay.
And kind of helps you out.
NurseIQ.com.
Nurse IQ also has reference cards.
If you guys are a new grad and don't know, or maybe you're just scared about being a new grad, Barbara here has Nurse IQ little note cards. There's a lot of them out there on Amazon, but I think yours are the most cute.
Thank you.
And
I bought them.
The most
I bought them and I used them. Yeah.
I'll send them to you.
I would Google them. I would look them up. Go to nurseiq.com and just check it out. It's really nice.
So cool.
Okay, Ta. So, what are your hacks, or how do you get your day
So
started?
for me, it's a bit more different. So
Okay.
I always know like we have medications at 8 a.m. or 9 a.m.
Okay.
So first I go and grab my report sheets. I put their like stickers on there just so I have all of their information.
Mm-hmm.
Then I get bedside report because I'm like, no, it has to be a bedside. As they're giving report, I assess the patient. I look at their lines. I follow their drugs. Just make sure
You just
it is.
follow them down?
Yeah, I
Okay.
follow them down like just to make sure because being
Yeah.
on Eurofloor, sometimes they have an EVD and like I don't want any drips going somewhere there shouldn't be.
Yeah.
Is the A line connected? Like I just like they're like, oh, the A line's here. I'm like, okay, do you follow the A line or the cuff? Because both of it shows your blood pressure. You know,
what do you mean?
which one's more accurate,
Okay.
the A line or the cuff? Because the A line's not always accurate for every patient.
Right.
You do the flow of return and you like check to see which one. So I just ask. Sometimes the A line says 190, but the cuff says 130, so I'm like, which one is more accurate? And then of course I like test it out myself too, but I just ask. Once I get a report, then we go, because usually you get 2 patients in the ICU.
Okay.
Then I get a report for the second patient, and then when they leave, first thing I do is I go in and fully assess them myself.
What do you mean by fully assessed? Because so many, head-to-toe assessments are totally different than head-to-toe assessments in nursing, right?
Yes.
Yeah.
So you do it based on your floor, being
Okay.
in your ICU. So like as a giving report, I can't do full assessment. I just like look and follow, and then when they leave, I'm like, okay, now I have to really go check. I check their pupils. Listen. This is my first day having them. I'll listen to their lungs. I check everything, like pull out the covers, and then your ICU, you're like, can you wiggle your toes? And like the patient's not even there. Like they're not doing anything. But I do it anyway. I'm like, I pinch them, which I hate, just to see if they have muscle
painful
contraction.
stimuli,
Like. All of that, that's my assessment in the ICU. You have to do that, because then the providers come, they're like, anything different? And I'm like, well, they must have contract on the right. Like I give them a 1 on the right, and then like, their hand drifts on the left. So like I have to fully assess them in the ICU in case it changes.
Yeah.
You just do like a focus assessment.
Focus
first,
assessment.
Focus
Yes.
at bedside, and then full assessment later.
Yes,
When
at
do you-
bedsides, you just quickly do like
Okay.
based on what they said, then I go
Yeah.
back and fully, because they'll tell me like, they'll be like, oh, their left leg is a 2. Like they don't move it, but they muscle contract. The right hand they move, but they don't follow commands. So I go there, I'm like, can you give me a thumbs up? Can you squeeze my hand? And then like they don't do anything. So I'm like, okay, yeah, it's a 2. Or some of them give a 3, but I'm like, they don't move the side at all. So I'm like, no, I'm not gonna chart 3 because they didn't give that to me.
Yeah, and that goes back to what you were saying. That like, did this just happen right now? Did this trend change right now? Do we
Yeah,
need
where
to
the
think about it
changes,
now?
are they getting better or are they getting worse?
Exactly.
Yeah.
Exactly, yeah. So I fully assess one patient, then I go next door, do the next patient, then I come and I look at all the medications I need to be given.
Okay.
So if it's at 9 o'clock meds, I wait, it hits 8, I'm like, okay, 8 and 9, combine them. Then I go do that. However, if I don't get a good report, then after I do my full assessment, I pause and I read. I'm like, what did I miss? Like,
What do you
I don't
read?
fully understand. Like, I read clinical
H&P
notes.
Okay.
Clinical notes and like forms, just to really make sure what's going on with this patient.
Okay, that's-
Why are we giving this, or what's
Yeah,
going on?
okay.
Like I kind of, in the morning, it's a bit more calm typically. So if I have the time and I felt like I feel uncomfortable, I don't really know, like the report was like crap. Sometimes that happens, So like I just go back and I read through everything. But typically report is good. And after I do my assessment, I have the baseline.
Yeah.
So quickly go grab my meds, I do that. And also I always ask, what's the plan for today?
Okay.
Like, do you know this patient has any procedures going on? Like
Okay.
I always ask, so that way if I know ahead of time, then I like mentally like mark that in my head. Sometimes you don't, and like she said, you have to be open. Things happen. And then my unit rounds, like with the providers.
Oh yeah. In the ICU you do rounds. I
Yes, so
forgot
you do
about that.
rounds. So then
get
I
orders all
always
the time.
anticipate. So I'm like, I have to get some charting. Sometimes I'm running around, didn't even have time to chart one vital sign, right? And it's like 3 hours later. And in neuro, we chart every hour.
Oh.
Everything every hour, so it's a lot of charting.
Dang.
So then I'm like, oh, we're about to round. They need to know something. You know what I mean? Like they need to know the vitals and et cetera going on with this patient today. So quickly, I'm like, okay, I have to make time to quickly chart at least 1 hour. So when you're around, they know what's going on with the patient today. Like,
That's what I always tell my new grads. I'm like, the minimum you should do in the morning, at least put your vitals in, because the providers are on their computers and they can
Yeah,
see exactly what you're
exactly.
putting in. At least the vitals are there, so they can see kind of what's been going on for
Yeah.
us this morning.
and then I go into roundings, and after roundings, all the orders change.
Oh man.
Because they're like, oh, we don't need this, or we need this, or can you do this, or like, let's do an MRI, let's do a CT, and let's do a chest X-ray, and then so you're just like going with the flow. But as long as you do your baseline, they're like, okay, you got it. And then we do Q4, so we do every hour neuro checks, but every 4 hours we do more. We do full assessment.
Okay.
So every 4 hours, I'm like, okay, I know I have to go do this so I expect
Full
that.
assessment every 4 hours.
Every 4 hours, and then like focus assessment every hour.
Snap.
So
okay.
based off that, I know how my day is gonna go.
Okay.
Yeah, so that's how I plan it out.
And then when you leave work, what do you do?
Oh, when I leave work, okay, my therapy is I put my windows down. I don't care how cold it is. I don't care if it's raining. I need fresh air. Like,
Okay.
that was a lot, and I just like take a deep breath and like mentally I'm like, okay, I'm letting everything go out. Yeah. And the wind's
Yeah.
like blowing, and I'm like, but it feels good. I just let it out, and then I sit in my car for like 30 minutes, because I can't get out. I'm just like chilling, listening
Yeah,
to music,
unwind.
like by
Yeah,
myself. And then I go home, I eat, and then I always have to watch an episode of Netflix.
Okay.
I need the sleep,
Yeah,
but I
same.
can't because mentally I'm drained. So I need to
Yeah.
do something fun. I need to do
Yeah.
something cool. So I watch something funny. It's just how I decompress.
Okay.
Same.
I have to watch something and then I go to bed. And then same thing again next day.
And like sometimes I leave work and like I'm so drained and exhausted that I don't want to hear music and I just like sit in silence.
I don't talk. I don't talk to
in
people.
silence. Like I don't want to hear
Talk to me.
anything. Like I'm still processing what happened and I'm just
Yes.
like in silence and I don't even notice sometimes till I get home. I'm like, I didn't play
know.
anything.
Yeah.
And I'm the same. Sometimes when I go for my lunch break, I go where no one is sitting. And I'm like, I just need to be alone. I don't need anyone talking to me. I don't want to hear anyone's voice. I just need like half an hour of just
Yeah.
silence.
Yeah.
Quiet.
Yeah.
After work, everyone knows not to talk to me.
Yeah.
If you're my friend, I'm not
Yeah,
responding
same.
to text message. Don't call me.
Yeah.
Don't talk to me. And then like I live with my sisters. No one talks to me after I come home because they know like I give everything at work, like mentally, emotionally, physically. I give it all to my patients. So when I'm home, I don't have anything left in me. So like
Same.
talking to someone else will drain me more.
Yeah,
so I don't
just
do
like-
it. But then after I do my 3 days, I love kickboxing. That's like my new thing.
Okay.
That's how I really stress. So that's like my thing I look forward to. I'm like, okay, I'm done with work. Now I can work out. I can go to fun workout classes and like do fun things. But I don't do it while I'm at work. I like can't. I know some people wake up at 5, like they wake up earlier and they work out before work on day
Oh
shift.
man.
I'm like,
these
that's
people?
mind blowing, but I love sleep. I can't. I wish I was that person. I really do, but I'm not.
I have to do it at the end of the day.
You have to make
Yeah.
a routine, like she says, a routine that works for you, like mentally and physically.
What are you guys' routines for new grads? Is it just you wake up, coffee, breakfast, or you bring your food to work?
I bring my
or-
food to work.
Okay.
Like I'll get to work early and I'll eat in the car.
Okay.
For me, that's like peaceful. I
You
don't
guys
want
do your
anybody to talk to
makeup
me.
in the car too, or
I do not wear makeup.
you not wear makeup? But okay.
I used to before COVID because
Okay.
I started a little while ago, and I'm like, you know what? Like it makes me feel so much better at work. I put on some cute scrubs. I do my
Okay.
hair a little bit, look a little bit cute, and it just makes me have a bit of a better day. But the eating thing, nursing, for some reason, I don't eat until my very first break at 11 a.m.
Yeah.
And so my
Intermittent
body
fasting.
is now trained to just
Yeah.
not eat in the morning, and that's
Okay.
because of nursing.
Mm-hmm.
But
She's fasting
Yeah,
regularly.
I'm fasting.
Before intermittent fasting was cool, she's doing it.
been
Yeah, she's been doing
thanks
it.
to
Yeah.
nursing.
See, I make a smoothie in the morning. Like I wake up, make a
Okay.
smoothie, get dressed, drink my smoothie, then go to work, and then I just have snacks.
Okay.
So I'm just like snacking. I'm like charting, takes a bite, runs back in, comes
like-
back, takes a bite, and
One of
that's
those
how I
hiker
do it.
packs, like camel packs. in your
Yeah,
mouth, just-
yeah.
Sometimes that's the way you have to do it. Like in between procedures, like, cause you know, I finish the procedure, I take the patient out, I put them in recovery, and they still have to clean my room. So after I get reported to the recovery nurse and I write a note that I drop them off and I connect them to the monitor, I like, while they're cleaning my room, I like run and I'll have like a little snack if I'm starving, and then I'll go back. Cause sometimes I don't eat till like 2 o'clock. Like I'll get my break, I will, but like if we have a lot of procedures and the doctor wants to like knock them all out, like it's really his call.
Yeah.
So cause he has other things to do, he has to go to clinic, he has to go around on the other floors, he has to go see what other procedures, so like you kind of have to work around their schedule. So like whenever you get a chance, like take it. Like, oh, I'll be right back, I'm gonna go eat a snack. Like
Yeah.
snacks are like
I
the way to
always
go.
bring so many snacks with me because you can just put them in your
need it.
pocket.
Yeah,
and
yeah.
quickly run out and just like while you're.
That's
Nobody
the
will
biggest-
know. Yeah.
That's
Who's
the
gonna
biggest
know?
tip for like, especially if it's your first day and you're a new grad. Bring snacks, put them in your pocket because you don't know when your preceptor is gonna eat.
know.
I had a preceptor. He doesn't take lunch. He doesn't eat. He just has his coffee the whole entire
The
day.
whole
That's it.
12 hours, doesn't he?
And like this is his routine.
What the
So you have to be open. Whatever you figure out your routine, trial and error.
Yeah.
What works for you and what works on your unit. Like my unit is not set where you can have breakfast. You don't have time. You barely have
Yeah.
time for lunch.
Smoothies, maybe, yeah.
Yeah. So things like that.
Crazy.
So you have to really bring snacks on your first day and then figure out what works for you.
What kind of snacks? So people.
Protein bars.
they're not
I love
gonna
protein
waste.
bars.
Easy
Okay.
things you can fit in your pockets.
What kind
They're
of protein bars?
I like Power Crunch bars. Those
Power
are really
Crunch.
good.
What
Fiber
flavors?
bars.
This is not sponsored, I just like them.
Okay,
I
okay.
really
They
like
should
them. Those
sponsor
are
her.
good.
Oh,
Yeah.
the wafer ones, yeah?
Yeah, they
The
taste
vanilla,
like Kit Kat.
caramel.
They taste like Kit Kat. Like
Yeah.
they're so
Power
good.
Crunch,
They
yeah.
have like 1 gram of sugar, 5 grams of sugar. Like it's low and it's good, and it fills me up.
Did someone say string cheese as well? Wait, what did you say?
String cheese is
String
good.
cheese
I
is
said
good.
fiber bars. I do
Fiber
this thing
bars,
where
okay.
like she was talking about meal prepping, but what I do is I buy like boxes of like bars.
Okay.
And what I do is like I have my work bag and I
Okay.
just empty it in there.
Shut up.
So I always have snacks.
There you
Sometimes I
go,
get lunch,
there
I
you
just
go.
like snack.
Uh-huh.
Or someone next door is like, I'm starving. I'm like, here you go.
Yeah, always have
You know,
extra.
I always have extra so that I don't ever run out.
Okay.
Costco's good for that too.
Yes,
Go to
exactly.
Costco wholesale.
Whenever I grocery shop, I just buy them and then empty them out. Or you can leave one in like your
You guys-
trunk,
Your
and then you're
locker,
like,
too.
oh man, like I ran out of snacks. Empty it
You
into
guys
the
are
bag.
literally. You guys are literally the meme. Do you ever seen that? My neck, my back, my Netflix, and my snacks.
No.
Oh, that's literally you guys. That's a nurse.
Wait, it really is us.
It really
It's so
is.
funny.
Netflix and
Yeah.
stuff. All right, so now we're going to transition into nursing school topics. So, just at a general level, is there anything that
pissed you off about nursing school? What's the number one thing you would change about nursing school if you had a chance?
I think care plans are a waste of time.
Care plans, yeah.
I have never in my life done a care plan or a nursing diagnosis
Okay.
being a real nurse.
All right.
Like that, this just doesn't happen. It's such a waste of time, and it pisses me off because I spent so many hours and hours and hours having like a perfect one, and the nurse like revising me, the like clinical instructor, like another nurse revising it, bringing it back to me like it's not good enough, better formatting, better this, better citation. I'm like,
Yeah.
are you kidding me? Like that was such a hot waste of time.
Yeah.
It could have been spent on like
Studying.
Studying or
Right.
practicing clinical skills,
Skills,
like
yeah.
Clinical
anything that's
experience.
actually going to benefit you as a nurse.
And there's so many, and there's so many times like when I was in nursing school and I had clinicals, like we would like beg our instructors to let us leave clinicals early, which is where you get your experience, because we had a care plan due, or we had a
Oh
writing
my
paper
gosh.
due, or we had this, we're like, oh please, we have a test tomorrow, and I have a 5-page care plan to turn in, like, can we leave early? And like I missed out on cool experiences to write a lame paper that I'm never gonna use.
Yeah.
BS.
Yeah.
So you've never used care plans?
Never in my life. Have you?
No.
Have you?
No.
And I hear like I the other day I put on my Instagram and it was like those like ask me anything and I was like, please share the top thing that you did not use in school, and I got over 130 care plan. So I know I'm not alone.
Okay.
Yeah. Like people don't do that. It's
So time consuming, that's all.
so time consuming and irrelevant.
And you don't really learn from it.
Yeah, so my school, we went away with care plans like 2 years after I graduated, so yeah. that's
Yeah,
pretty-
mine we didn't have too many, but honestly, just anything that isn't like we had research methods and like writing essays
Yes.
and stuff, and I'm like, we could maybe focus on other things that are actually going to benefit the students in the long term, rather than focusing on how to do all these calculations or not. Medication calculations is a different thing. I mean, like research methods, like doing I don't know all
Yeah,
like
all the
just
BS.
stuff- yeah,
Yeah.
like
Yes.
this is just not.
Did you get
necessary.
Do you have your BSN or?
I had my BSCN, and then I had my Bachelor's of Health Sciences degree
okay.
before that.
Do you guys think that if you're a bachelor's trained nurse, like if the bachelor's even helped as a clinical practice, or?
I think the bachelor aspect of it is more research
Okay.
based. So like it's not, our skills are like kind of the same. I think and technically you just do more evidence-based research.
Okay.
So like it's more papers and things like that.
Did it
And that's
ever-
what certifies you to be like bachelor versus like 80.
Did it ever translate into your clinical practice?
No.
Okay.
No, it's
It was
literally
busy work.
Yeah.
That was unnecessary and I could not
Okay.
use the time to study.
it's busy work. A nurse is a nurse.
Yeah.
You pass the NCLEX, you're a
Yeah.
nurse.
Yeah.
It doesn't matter.
And then
It's
your,
what degree you have.
I always heard that your clinical experience, the hours that you put into being a nurse, the years of experience is way better than any degrees.
Of course.
Yeah.
When I graduated school, I was like, I don't know. When I graduated school, I was like, oh, I'm so smart. I know everything. I passed my NCLEX in 45 minutes, 75 questions.
Yeah.
And then when I got to like my first day of work, I was so humbled because I was like, oh my God, like I don't know anything. Like I don't know anything. Like all I know is like Metropolo is like for blood pressure, and I know like the quiz answers like, oh, check the heart rate and check the blood pressure before. But like I don't know anything. Like I don't know how to do this, how to do that. I don't know how to communicate with people. I don't know how to call pharmacy.
Yeah.
I don't know how to like
All these little things
Yeah.
that aren't taught in nursing school at all, and you just kind of have to learn as you go as a new grad. It's
There should be a class on like how to communicate with like pharmacy, dealing with
Yeah.
social workers, working with other people in your team. There should be a class on
how to
that.
talk to
really
family
should, yeah.
members.
Yes.
How to talk to family
How to give
members.
report.
How to give report?
How to
Okay.
give report should be like a whole course in itself. Or like also like mental health. I feel like it's very important.
Making time for yourself.
Making time for yourself so that you're not depressed. Like
Yeah,
nurses
or
have been-
burnout, yeah.
or burnt out, so you don't get to the point of burnout, and what to do
Right.
when you're experiencing burnout, and how to negotiate pay should also be like
Yeah.
a thing, because like nurses have been there for many years and they're like making the same rate as like me who just got hired, because when I got hired I said I'm only working for this much an hour, and if you don't give it to me I'm not gonna work here.
Wow.
Yeah, you have to, and like you know the job is in demand and you know they're gonna give it to you, so you have to take advantage of the situation and tell them what you want, and like just
I feel like I could be biased, but I feel like nursing school prepares you to fit into the standard of what the hospital wants you to be.
Yeah.
They don't teach you how to network. They don't teach you how to use LinkedIn. They don't teach you how to negotiate,
Right.
how to stand out, how to optimize your pay, things like that. They want you to go there and accept the base rate. They want you to. They tell you, think about your mental health, but then they also want you to overwork and pick up
Yeah.
shifts and do things like that. Like they want you to fit into the box that benefits the hospitals.
That makes sense. I mean, it's kind of like a high school diploma, right? When was the last time you used geometry, algebra?
Never.
Yeah.
Calculus.
So, yeah, exactly. No one ever uses that stuff.
Yeah.
So maybe it's like the base thing, and then no one teaches you those skills that you need after. So speaking of like negotiating salary, that's really interesting.
always.
You just put it black and white out there after you had experience, right?
After I had experience,
That's the key thing, yeah.
after I had experience, I went into my job and I interviewed and I was like, oh, I have experience working on a pulmonary step-down unit. I have experience working COVID. I've been floated here. I've been floated there. I've worked med-surg. They've floated me to COVID ICU. Technically, it wasn't ICU experience, but let me tell you, it was ICU because my step-down unit is considered ICU in many other hospitals across the U.S. The things that I did were, very advanced. So I have a lot of experience. I work night shift. I've worked day shift before too. This is all that I've done. This is how much money I want an hour. And if you guys aren't willing to give it to me, I'm sorry, but I'm gonna look elsewhere because I know that that's what I'm worth.
Yeah.
Of course. And
That's
at
what
this
you're worth.
point, they need you more than you need them.
Yeah.
So.
You always put your worth out there, and then lo and behold, they gave it to me.
Wow.
HR called me, and they gave me the rate I wanted.
Dang, okay.
Yeah.
All right.
And I got a sign-on bonus.
Whoa, okay, that's good.
And I think the worst case scenario is they say no.
Yeah.
So just shoot your
Yeah.
shot and ask.
And you just go next,
And
right?
sometimes they'll come a little bit less. Like you ask, for example, they say $56. They will come back and be like, we can offer you $49, and then you like, hell yeah, that's way more than like.
Yeah.
Right,
Always
yeah.
overshoot it for sure.
Yeah.
Say I want 38, and they'll be like, we can only give you 35. Okay. Well, either way, I was making 29 before,
Yeah.
so it is what it is.
$35.50. No, I'm just kidding.
Yeah. Don't double negotiate.
Yeah, no, I'm just kidding. Okay, so other than care plans and getting real world experience as a nurse, anything else you would change about nursing school?
I think like the culture of nursing school, where it's
Okay.
like you must be stressed out. Like
Right.
I remember doing my orientation, they were like, order scrubs a size bigger because all you're gonna do is sit and study, and then you may gain weight. And to me, that was so toxic because
Yeah.
I was like, why would you say that? Like you're scaring us before we even start. And one thing I learned, and the best advice I can give, is don't let other people's experiences become yours. You go in there unbiased. You create your own experience.
You create your own reality.
It doesn't have to be that hard. Like, yes, it is very hard, but you don't have to be extremely depressed. You don't have to have anxiety. Like, people project that onto you before you even start. And
Yeah.
I think
I
that's
agree.
what ruins people's experiences.
Do you think nursing school makes it harder than it really has to be?
Yes.
Yeah, 100%.
And they just kind of self-sabotage the students? Because, I only say this because it's like, in nursing school, there's only two things. It's pass tests, or basically to pass the NCLEX, and get your clinical hours. Those two things. And then they throw in care plans and papers and all these things that you don't need.
Unnecessary.
And it's like, you can't spell, BSN without BS.
You can't.
Yeah, so.
That was my quote on my little
Was it?
graduation cap. I pushed through the BS and got the degree.
Oh, okay.
Yeah, it was cute, but literally that's why.
Yeah.
I also feel like in nursing school, just knowing that everyone else is also struggling, because a lot of people just kind of are faking it and pretending like, yeah, I'm doing great. I'm passing all my tests. I'm getting so much sleep. I'm working out all the time. And I think a lot of the time, just being able to relate to your the other students and knowing that we're all kind of going through this. It's difficult, but we'll get through it. Rather than kind of fighting each other.
And there's
Trying to
so-
compete with one another.
Yeah, and to add
Yeah.
to that, remember your grades don't define you. Just because someone next to you made a 96 and you made a 76 doesn't mean you're going to be less of a nurse.
It doesn't.
And I want to remind students that because sometimes it's very discouraging. You could have been a straight A student before nursing school, but nursing school exams are different. And sometimes it's not really set up for success. So it's just a reminder of don't compare yourself to other. I never shared my grades.
Yeah.
As soon as they would come out, people would be like, what'd you get? What'd you get? And I'd be like, oh, I don't like to talk about my grades.
Yeah.
I didn't want to hear other people's grades, and I didn't want to share mine because then instantly I would compare and I would feel bad. And I just didn't want that because I was like, this doesn't define me as a nurse. Because people told me that and I stuck to that.
And how many times has a new job ever asked you for your GPA?
Never.
Okay. Or the school you went to?
Yeah, I don't think that didn't matter for me either.
Was it just the RN? You passed the NCLEX? No.
You pass the NCLEX, you have your BSN, you're
Yeah.
an RN. Okay, come work here.
Really?
Apply for the residency
Okay.
program. I don't think that really matters. I mean, so I went to community college first in order to save money because I also had Florida prepaid.
Yeah, I went too.
Got money back.
Yeah.
And then I transferred to a private university just to get my bachelor's degree, and that was it. And
Yeah.
it was perfect. And I saved so much money. I have no student loans. I think that's the way to go. If you can go to community college or you can go to a cheaper option, or if you get a full ride scholarship, use it because it's better than going to a super high paid university, being in debt, and then having to pay that debt back.
Yeah.
Just be smart, financially.
Of course.
They don't teach you that in school either.
They don't teach you that
No
in
one
school.
teaches you that. Okay, so if you're looking at this going into nursing,
Yeah.
everyone thinks that, I got to get to the best university, the Ivy League,
Doesn't
spend
matter.
$60,000, $80,000. I went to community college. Instead of paying, $50,000 or $60,000, $80,000 for a private university, it was $4,000 for me.
Yeah.
2 years.
Wow.
Yeah.
Same.
Nice.
And then you end up at the same job.
Same job,
job
same
as
pay.
everyone else who went
Yes.
to Ivy League and you went to community college and now you're working the same exact position, getting paid
Yeah.
the same
Same
exact
hourly rate.
amount.
Like
The difference is you don't have
You're not in
$100,000
debt.
Yeah.
loans and they do.
And the big, no one tells you this, but after you get your NCLEX, after you get your certification as a nurse, you can get your BSN. You can actually skip your BSN. You can have your associates like I did as a 2-year community college nurse. Now you can skip your BSN and go to your master's
That's
in
amazing.
12 months.
Wow.
It used to be 18 months, 19 months. I did mine in, 12 months for less than 12,000.
That's
So there's
awesome.
so many options out there.
Yeah.
Yeah.
So yeah,
You can do it online.
you can do it all
Totally
online. Mine was all online, yeah. And so yeah, it's just crazy. And it's funny because everyone tries to sell you like, oh, this is the package that 3 years and all the private universities on the West Coast. It's just like, it's crazy.
It's not worth it, man.
No, not at all.
Really.
All right, so now let's talk about test anxiety. Do you guys ever had test anxiety?
Oh, 100%. I am a terrible test taker. Like I can tell you, like I know the information.
Yeah.
For some reason, I was just always bad at test taking. Always.
Did they put you in that separate room? And
No,
Oh, okay,
I never did that. I should have. I really
You
should
really
have
should have,
because
yeah.
like
What do
early
you mean?
on.
Hold on. What do you mean private separate rooms?
So,
So-
you can get a diagnosis of
Yeah.
anxiety.
Shut
and,
up.
and they'll like make accommodations for you. Even on the NCLEX, they'll be.
That'll make it even worse. I
No.
want to be by myself in a room.
No,
Stop.
it does it. Yeah, it does. And they'll give you more time, and they'll be like, yeah, they'll give you like,
up.
yeah, Xanax and like.
Wow.
Ativan. No, I'm just
They
kidding.
won't give you Xanax, but
No,
they'll
no, I'm
give you
just joking.
additional time. Like for example,
Yeah.
if people have an hour, you will have like an hour and 30 minutes.
Yeah, and they have therapy dogs.
But for me, it's like I either know it or I don't. An hour and
Yeah,
30 minutes is not going to change my answer because I either
Or
know
you're gonna
it
go
or
back
I
and
don't.
change your answers. You were right.
Well, I couldn't
to
go
wrong.
back. Could you guys go back?
No, it was on.
No.
It was all online, and you can only press
Oh.
next.
Yeah.
I couldn't go
I
back.
could go back.
Oh, we couldn't
That's
go back.
toxic. I don't want to go back.
Yeah.
I feel like I'll go back and change everything.
Well, that's the
Yeah.
worst part. Every time I went back to change it, it was
was
always
wrong.
to the wrong answer.
So it was your
Okay.
first instinct. Your first
gut.
instinct
They
is
do
always the
say
right
that.
answer.
Yeah, they do say
Like
that.
you read
Go
it.
with your gut.
For me, I read really fast, so
Okay.
I was
Me
always
too.
the first person out of the room. Like the
Oh.
first or the second person out of the room. Like I'll be the first person to know with my test.
That always gives me anxiety. When I see
And-
someone leaving, I'm like, oh,
I know, and I feel whatever. It's
That was
for
you, that
everybody
was
else
you.
was there, like, how's she doing so fast? I'm like on number 10. This girl is 25 already. Like,
Mm-hmm.
but I just read fast. I read it. I read all the options, and the first thing that came to mind, I don't second guess it. I just next.
Mm.
And like that's it. That's how I did it, and like that's how I did well. Whenever like I would like read slow and like go like one by one,
Mm-hmm.
horrible grades. Whenever I went fast, 95, 98, 100. Like
okay.
And you learn that as you go because
Yes.
before nursing school, I never studied the same way. I never
Yeah.
tested
Yeah.
the same way.
You
but
have to
nursing
change
school's
it up.
different.
it's totally
It's
different.
critical thinking. You know,
Yeah.
it's not
Every
like
answer is correct.
exactly
Yeah.
but which one's most
Which one's
correct.
Which one's the
Correct.
best
Yeah.
answer?
Or select all that applies.
Did
Yeah.
you know that
So that's how that applies.
the NCLEX is coming out with none that apply?
Shut up.
Instead of select, have you heard about that?
I'll
I heard about the new NCLEX coming out and I read
Yeah.
into it a little bit.
Sounds like a nightmare.
Yeah, that'll be
Yeah.
a separate video.
Yeah,
and
we'll
give
talk
you all
about
the
that another
updates.
day.
Yeah. But how'd you guys deal with test anxiety? So you
Practice
probably,
questions.
Okay.
Yeah.
I think the best way to get rid of it is to prep early. Like actually study ahead of time, like have your study schedule, which I know is not always possible. However, practice questions, because when you do practice questions and practice exam, you figure out what works for you. Like reading fast works for her, slowing down, highlighting words, focusing on keywords worked for me. And I had to learn that through practice questions. So you won't know unless you do practice questions. And sometimes I would study something and feel like, oh, I know this, but I didn't understand it when he was asking me. So then really when you do practice questions, you will understand if you truly know the concept and the diagnosis, the patho, or if you don't.
How many practice questions, and then how many days before the test would you do this?
I know, because I'm like toxic. I feel like
Okay.
that's I will do so
Toxica.
many. I will do like 500 practice questions for like one subject. 'Cause I'm just crazy.
500?
I just
that's how you
it
did well.
helps me. That's
Okay.
how I did well.
How do you
Because
fit that all in your study schedule?
okay, so when I was in nursing school, I did not work. I feel like that's also very important to share.
Well, yeah, a lot
I
of
was a
people can't work.
full-time student. A lot of people have to work, and I feel like that's a lot harder. But I didn't work at all, and I was like full-time school. So like, let's say, and this is what worked for me. So like, Tuesday I had a test, and like I did an accelerated program. So that means that if I had that class every Tuesday, this Tuesday I have a test. We're gonna take the test. After we finish the test, we have lecture, and then after lecture next Tuesday you have an exam on what you just learned. So I have a week. So I'd be like, okay, today I did a test.
Okay.
So today is gonna be my rest day because I studied so hard and I woke up early. Today I'm gonna chill. Wednesday I'm gonna start reading chapter 1 and highlighting it, and then Thursday chapter 2, and then Friday chapter 3, and then like Saturday and Sunday, like I'll wake up early in the morning and I'll recap everything I did, and I'll look up videos like SimpleNursing,
Oh,
or
stop
like
it.
yes,
Yeah.
I'll look up like videos to like put that into practice, make notes on that, make like a little paper, and I'll use like markers, colorful, they call color code, and then I would use like the Saunders book, like the NCLEX.
Yeah,
book, to
that's
do
really good.
really good
Like
to do
it.
practice questions, and I'll do practice questions until like I can't anymore.
Oh,
So like I'll put a marker on for like 6 hours, like okay, these 6 hours are gonna be dedicated to school,
Okay.
and then let's say I'm going out tonight, so these 6 hours I'm gonna do practice questions, I'm gonna study, I'm gonna take a break, workout, and then tonight I'm going out with my friends, like have like the work-life balance.
That's good, yeah.
And like I would do that, but I would make sure that I studied every single day of that week until I had that test. I did something. And the day of my exam, I would wake up early, like 2 hours earlier than I had to, and I would do like I would review and do practice questions an hour before my test.
Okay, that's fair.
It's a little intense, but
That's really intense.
It's like a whole schedule.
Honestly,
it works for me.
it goes back to what she's saying is you
Yeah.
have to have a study plan. You
Yeah.
must have a study
Yeah,
plan
yeah.
because if you don't, then like you're not gonna be.
No
well
one even shows
prepped.
you how to study during nursing school.
No, and you
No.
have to learn what works for you. It's like
And it's so different
Yeah.
from one
yeah,
person
and
to the
even
next.
like what you study, how you study for pharmacology may be different than how you study for OB, you know? So you really
Yeah.
do have to. But I think if you create a study plan, then you'll figure out like, I'm not understanding this concept, but I have enough time to review, ask for help, watch videos, do practice questions.
Yeah.
So having the study plan and a routine. And also she said she took a day off and I'm like, yes.
Take a day off.
Take a break because
Yeah.
if you study 7 days a week, at that point your brain is so tired you're not even learning
You
the
don't care
information,
anymore.
and you're burned out, and that's how you have anxiety and like depression.
You're doing more harm than good.
More
at that
harm
point.
than good. Yes.
Yes.
Yeah.
No,
And,
but
like,
it's true.
I also felt good like when I got that next Tuesday when I came, I was like, okay, I studied Wednesday, Thursday, Friday, Saturday, Sunday, and Monday. If I don't know it, bro, I don't know it. There's
Yeah.
nothing
For real.
more. There's nothing more that I
Yeah.
could have done. I did the best I could.
And I see so many students self-sabotage themselves with like studying till like 3 a.m. and their test is at 8 a.m. It's like running a marathon
You can't procrastinate.
before yeah.
Like I know everybody procrastinates, but when it comes to like nursing school and studying for an exam, like that's just something that you can't procrastinate.
And for me, I found that like genuinely like understanding the topic rather than memorizing all these facts, like it just helps so much more in the exam because you actually understand what's going on rather than just memorizing what's in the book and then almost screwing yourself over on the exam when it's worded differently, when it's in a case study. So I found that going through, I really liked YouTube videos so that I can understand the patho behind
Yeah,
things.
yeah.
And then applying that to the questions just helped a lot more rather than memorizing an entire textbook.
Because you can't memorize the whole thing.
No.
You can't
Yeah,
remember.
yeah.
They never ask you like A, B, C, and D. They
Yeah,
give you
no.
a scenario and you have to think.
Yeah.
You know?
And then when it
you
comes
can't
to
do
like
that.
real life and you're with the real patient,
Yeah.
you're like, I don't know what's
Yeah,
going on.
Where's the multiple choice?
I only memorized that the answer is like
Yeah.
pneumonia, so like I don't know what's going
Yeah.
on because it's a COPD and I didn't memorize
Yeah.
that. You know?
Yeah, yeah.
Sorry, I
It's
don't
like
know.
C.
So I don't
Where's
know.
the C option?
Yeah, like you just have to like. So I think that's a great
Yeah,
a
of
great
course.
point. You have to not memorize. You have to learn the
You have to-
pathophysiology behind something, so you're able to answer no matter how they word the question.
Yeah.
You'll always succeed.
Yes.
And so that's a perfect segue into telling you guys why Simple Nursing and the way we created our videos. So the cool thing is like our idea was like, hey, what if we highlighted the book for you and showed you the patho of every single diagnosis and then also showed you the most tested key topics. So that's why I always tell students, watch the videos before you guys dive into the book. Because you guys know how it is. You can dive into a book and one chapter can take you 3 to 5 hours and you'll be lost in the sauce.
Of course.
So imagine if you had that treasure map and it's like, hey, these are the most tested out of 5 different schools and 5 different textbooks. So that's the reason.
And then you go to your textbook
Yeah.
and then you
Then
can
it's like,
read
oh, yeah.
further into those specific points rather than reading whatever 50 pages
Yeah.
and then like 5 hours go by.
Yeah, it's I tell students it's like pushing your car to work instead of driving your car to work. Like, what's going to be harder? So, you know, do one thing. It's going to
I
help you in
also
the
want to
end.
add to that, understanding the patho is the one thing that will help you when you do graduate nursing
Okay.
school.
100%.
Because you don't really necessarily, nursing school doesn't prepare you to be a nurse, but the pathophysiology you learn in nursing school, that's why it's so important to actually learn it.
Pay attention.
It helps you on the exams, yes, but then when you're a nurse, you understand the patho, then you understand what's going on with your patient. You
Yeah.
understand why you're doing what you're doing and how to prevent complications and what to look out for. So like even your videos now, I reference it back and I'm in the ICU. I'm like, oh wait, like I don't really understand this, like the neuro, ICP, all of that, we monitor that. And I go back and I rewatch your patho because when I understand the patho, then I understand the person like as a whole.
Yeah.
Everything makes sense. The
Everything-
medications that they're
everything
on,
makes
all the
sense.
complications, yeah. Like
Yes.
it clicks.
Yeah.
It clicks.
Yeah.
Yep.
I remember someone asking about hypertension crisis. Like, why does your eyeball, like, you know, why do you go blind? And I'm like, guys, like, think about it. All that blood pressure is just pushing against the end organs. It's just screwing everything up. And if you just didn't know that, and just try to memorize, oh yeah, the liver does this, the eyeball does this. Individually, it's so much more difficult. So yeah, that makes sense. So how did you guys, any more tips on test anxiety other than taking practice questions, understanding patho?
Take a break.
Take a
Go for a
break?
walk.
Okay.
Yeah,
Get some sleep.
just gonna get your mind off things. Have a life.
Okay.
Yes.
It can't just be all like focus on one thing. I feel like that's exactly how you get burnt out.
Yeah, form a study plan as well.
Oh, I like to like me and my friends and I would plan like, okay, like the test is at 7 a.m. Let's all meet here at 6. And like we'll have like coffee and stuff, and then like we'll all like bounce off each other. Like, okay, I'm gonna read a practice question, this, or like we'll review. Be like, okay, so what do we know about this? And they'll be, oh, I know this and this and that. Oh, I read this. Oh, I saw a YouTube video and it said this. And we're like, oh, guys, if you get a question on this, like, so that helps. So I would do a study group with my friends. I totally forgot about that.
Okay.
An hour before. So like if you can, some people like to study on their own. I like to study individually, always on the weekend. But when I get there and we all know our knowledge, we can all share our knowledge, and that's how you grow. Yeah.
I did that too, but never the day of, because someone would be confused and then they would confuse me.
Oh, no.
Or someone would argue with me over the wrong answer, and then I would get anxiety before the exam because I'm like, wait, now I'm so confused. They told me something completely different. So I would always study on my own, make sure I know the concept, and then the night before, like earlier in the day, like around 4 o'clock or 5 o'clock, we would do like a study session and like teach each other and do practice questions. And then if I was confused based off someone else, then I would spend that night reviewing that concept. And then the morning of, I didn't review. I got some sleep, and then I'm like, it is what it is.
So what was the test ritual? Do you guys have tests at 9 a.m., 10 a.m.?
It depends on the class.
Oh, okay, okay.
For me, like let's say my class at 7 a.m., you don't go to class, you go to like where the computers are, and that's where we're gonna test, and we're all gonna go to our little computer, log in, backpacks in the front of the room, nobody can have their backpack, their phone, nothing on them, just their ID. They go around and check, you sign in, you take the test. When you finish taking the test, you can leave. Class is at 8. So if you finish quick, I would finish so early. I would like leave, go to Panera, get like coffee, go to Starbucks, come back.
Okay.
But then some people like take the entire testing time, and then they would go to lecture. And then everybody's at lecture like this, like, what did you put for that? And then like, everybody's saying, I didn't put that. And then you're listening to people, and you're like,
I chose 42.
yeah,
Instead of like,
yeah, and it's so.
Virtue was never even the option.
It wasn't even the
You're
option.
like, oh,
You hear
crap.
people like, oh, I put 17, I put 34, and
Yeah,
you're like, I put Nebraska.
Yeah,
Like, what are you talking about?
That's
Like,
the one.
that was like a TikTok. I was like, what are you talking about? So yeah, so like that too.
What would you do before the test? Would you, wake up obviously?
Super early. I would wake up super early
Like what
because
super
I
early?
was so paranoid. Like an hour before I had to be there, because
That's super early?
An hour more than that. Like let's say.
Okay, like 4 a.m. or
So
5
I live like 30 minutes from like my school.
Okay.
So like without traffic. So like I had class at 7 a.m. I'd wake up at 5 and like leave my house at 5:30 because I knew I had to be there by 6:30. And then
Okay.
I would like stop and get coffee and stuff, and then meet with my friends at 6. And then we would study, and then that's what works for me.
You would study before. Okay.
would study before.
You
I
would
have
bounce
to.
things off your friends.
Yeah.
Okay.
Unless it was like a really hard test.
Yeah.
Like I remember one class was like too much for me. I hated mental health. That was the worst class for me.
Really?
Yeah, like psych. I don't know. It just didn't click. Like I hated that class with a passion, and like I couldn't study with anybody because I did not get it. Like it was just my thing. Every other class I did good. Like OB, I killed it. Peds, but that one, it just. Sometimes you need your own time.
That's fair, that's fair.
Yeah.
What would you guys do on the day of your test?
For me, my routine would start the night before. Like I would prep every single thing that I needed for the test day the night before, so that I didn't have to think about anything in the morning. And I would make sure I needed a good night's rest, because writing a test, especially if it's like a big exam that's worth like 30-40%, I need my good sleep. I wake up early, I have my breakfast, and I was like Utah. I didn't really do much studying on the day of.
Okay.
Just because I thought that would kind of mess with me. Like I would self-sabotage, and then I would think one thing when it's actually the other thing. So I kind of stayed away from studying. If I had to do anything, I usually made myself my own little notes that were typed up.
Okay.
I would review that really quickly, if anything. But biggest thing for me was just getting a good night's rest, having a good breakfast, and then just getting to school early. The last thing I'd want to do is be like running late for an exam.
Yeah.
The anxiety would just be a little too much in that situation.
Yeah,
I wasn't as organized as they were. And I feel like we have all types of students, and I'm that type that's always running. Like, I'm like, oh crap, I gotta be out in 5 minutes, wake up, like brush my teeth, grab my stuff, and run out of the door. That was me. It still is. That's how I go to work in the
I'm always
morning.
late, too.
Wake up, it was just like everything's like last minute. But one thing I did prioritize was sleep. because my reasoning was that if my brain works in the morning and like it's rested, I can think about what I know and what I don't know, and then I can be able to eliminate answer choices.
Makes sense.
However, if I'm super tired, I can't think. Even if
Yeah.
I know it, I'm too tired.
Your brain's half functioning.
It won't
How are you gonna
function.
expect
So
to-
I needed sleep.
Yeah.
But what I would do is I would get in bed like early, and I would have my notes or my laptop, and I would like just fall asleep with it.
No, you wouldn't.
I would.
So you wake
That
up
was
and
my
you're like,
routine. Or sometimes I would just like
Shut
put it
up.
right next to me,
Yeah.
and I would sleep next to it.
Oh my god.
And that was my routine. And then I would get up, I would close my laptop, or like take my notes, put it in my bag, and go to class. Go. I would show up early though.
Yeah.
And I would just have breakfast, and I would wait like outside of the classroom. I would just have breakfast, and I would just be on Instagram.
What?
So then I'm not stressed out, because if I'm stressed out and I have anxiety, or if I like do practice question and I get it wrong and I like freak out, and then I have test anxiety. So that was how I prevented my test anxiety, and I had to learn that the hard way.
That makes sense.
Yeah.
And I think someone mentioned the Saunders NCLEX book.
Yeah.
Oh my God, I wish I had this thing throughout all of nursing school, because they do a really good job at telling you all the key points of what's going to be on your exam. And their practice
condensing it.
questions are so good. I regret not getting that. So if you're a new student, grab that book, because
Yeah.
it's extremely helpful.
Okay, I'm that student once again. I got it and never used it.
No.
Oh,
I got
girl.
it first semester of nursing school. I never used it. But what helped me, and I think this is individual, you have to learn what works for you.
Yeah.
Yeah.
I'm a visual person. So
Okay, that's
like
fair.
Mike's videos, like SimpleNursing and YouTube,
Yeah,
is how I learned. Reading it, like I would get tired and exhausted. And like, I would do like ATI practice questions, or I would do SimpleNursing practice questions.
Yeah.
I would always do practice questions, but I never opened the book. Actually have like, I even bought their NCLEX practice question book.
Oh,
like
wow.
it's just practice questions.
Yeah.
It's literally still wrapped. I never even
Oh
opened
my
it.
gosh. If
Never
you guys
opened
need
it
it,
because
he has it.
I did what worked for me, and it was easier than carrying a book. It was easier for me to have my laptop. So I would do practice questions online, or I would like use SimpleNursing app, and then I would be in the grocery store and I'm waiting in line, do 5 questions.
Yeah.
That's fair.
That's what worked for me, and I was very visual, so I couldn't read like the key points. I watched the videos that
Yeah.
told me the key points.
But I mean,
that's how I learned.
On average, because I used the Saunders book when I was preparing for the NCLEX, not during nursing school. But on average, the nursing student uses 3 to 5 resources when preparing for the NCLEX as well as nursing school.
Yeah.
And then everyone has those pictures, right? It's like, here's a stack of books.
Yeah.
Let me take RN.
Yeah, that's so funny.
Yeah.
Stepping on my books, like my little high heels.
But that's what I mean. Like,
Yeah.
there's something for everyone. It's kind of like bar hopping, right? Like or listening to music. You know, everyone uses and listens to a variety of stuff. Whatever works, whatever helps. And it's funny because we actually started using the Saunders review book instead of our videos to reference them.
Okay, good.
Yeah,
Well,
very cool.
also, you know, nurses make like my nurses are the ones that teach. Like my nursing instructors have all been nurses for years and years and years. So, you know, they're busy too and they have lives too. And a lot of the times they do copy like word for word, at least where I went to school, or like I know they'll copy like word for word or tweak like little words, like practice questions from Saunders or other books.
Or Quizlet.
I found
Or
that so many
Quizlet.
times.
So like, cause
Yes.
like there's only so many ways you can reword something and
I
just
know.
like get ideas. And some questions are just so good. So teachers will reuse questions from other books. And if you already did 1,000 practice questions, you remember word for word. You remember it was this one.
Yeah.
It's like pass.
Okay, I will
Yeah.
say
Yeah.
they started to change things and Quizlet started going down. Like, cause I like recently graduated because they caught on to that.
Really?
However,
It was a
the
Quizlet
concept,
problem?
so many Quizlets got taken down. So many Quizlets.
Why would
To
instructors
the point
not-
where actually there was a nursing student, not in my school,
Okay.
but a friend of a friend who got kicked out for using Quizlet in one of their assignments.
Wait, what do you
Because they were
mean?
so against it because Quizlet has all the answers for everything, right?
But why would
How are
instructors?
you in the wrong for using a resource online though?
Because they considered it cheating.
But
That's so dumb.
what also helps me is like doing practice questions. I'm not just memorizing the answers B. I'm reading the rationale
Yeah.
behind the question, and it's explaining to me why it is that answer, and the rationale helps me.
No, but-
so if you reworded it, I understand the
You know
concept
why
again.
that
I know
is the
why.
answer.
But also read the rationale on why the answer you chose is wrong.
Mm-hmm.
Because
Yeah, of
then you
course.
will know why this wasn't it. However, going back to what she said, even if they don't use that like Saunders book, the concept is the same.
Everything's the
Same.
same.
It's
No
the
matter how you
same.
word
So
it.
at the end of the day, no matter where you do your practice
Mm-hmm.
questions, the concept is the same. So like if you do practice questions, you will do very well.
But it was funny because when we had to redo 1,000 of our simple nursing videos, the idea was, hey, there's 5 different textbooks. Everyone prepares you for the NCLEX, right? So like, you know, HESI, ATI, Saunders, all the other ones. And it's like, okay, what if we took all their questions and strained them and say, where are all like the key questions coming from? Which topics? What are they asking? And all those key points, it's like, that's how you know
the key
yes,
points. And so that's how we make actually simple nursing videos. That's how we say like, this is the top tested stuff.
Yeah.
So we just focus on that.
Yeah.
But that's the beauty of it, because it's like, you don't need to know everything about everything of nursing. You just need to know the key points of how not to kill your patient and how to delegate and prioritize.
Yeah, you need to prioritize in nursing school. It's going to be impossible to know everything about everything. So you need to prioritize. If your prof brings it up, if it's in your lecture, if it's in lab, it's probably an important thing to know.
Yeah.
Not every single word in your textbook is a need to know topic.
highlighting
That's how
the
you answer
whole book.
test questions, because
Yeah.
they're all correct, but which one's most correct? AKA, which is what is priority?
Yeah.
What will kill the patient? And that's like your key point. So like, yes, it matters that like they have high blood pressure, it matters, but like what is the most dangerous to the patient?
But it's even like how they phrase questions,
Yes.
right? It's
Yes.
like, like,
Tricky.
oh man, so tricky. Like your patient is agitated. That's mental status change. Or it's like your patient, like to describe confusion, they use a different word.
Yeah.
And so we include everything in our videos at Simple Nursing. So don't worry, we got you. But yeah, nursing school can be tricky and just like frustrating.
Beyond.
And I think when you're learning these study methods, like we were saying that there's so many, the first study method that you try may not work for you, and it's a little bit frustrating. For me, my first semester, I spent all of the semester just writing out notes over and over and over again, because that's how I used to study. And I didn't do really that well on my tests, because I'm like, okay, this didn't work for me. I wasn't actually understanding the topics. I was just writing things out over and over, thinking that it's gonna get stuck in my head. So don't be frustrated if you don't do too well
Yeah,
the
you can
first
always
try.
adapt.
You really have to figure out what works for you. There's so many different methods of learning. I know some people re-listen to recorded lectures or audio, like audio learners, visual, there's so many. So if your first try of your semester doesn't go
this
too hot,
Yeah.
like,
Same method may not work for every specialty. For example, she brought out psych. I remember I studied differently for psych than I did for any other, because psych,
It's different.
the questions are formatted differently
Right.
than like med surg, and you have to make that switch in your brain. So I remember for psych, I spent a lot of time doing case scenarios and like practice questions, because that was the only way I was successful in psych. So every class is a bit different, and you have to be flexible and open to that.
But it's funny because therapeutic communication is like so frustrating. It's like, how do you even respond? It's like, okay, just assess. And how do you feel about that? You can't have your own opinion about anything. And
No.
so, yeah, that was interesting.
That was a lot.
Your face, you're like, I want to offer my opinion, but no.
No, stay quiet for this one.
Yeah, exactly. Okay, approaching the NCLEX. If you have test anxiety, you're gonna have NCLEX anxiety. Everyone has NCLEX anxiety. It's like jumping out of a airplane or going skydiving.
Oh, so me,
What are recommendations? Yeah, tell us your experience.
me, the day of the NCLEX, of course, same thing I always do. I woke up like 2 hours early,
Okay.
doing practice questions. Why? I don't know.
Oh, okay.
I know, I need to stop. Like, I need to stop. I woke up, I remember NCLEX at 9 a.m., and I'm up at 5, doing practice questions on UWorld, like going
Yeah,
crazy.
yeah,
Oh my God,
everyone does.
crying.
Yeah.
I had like diarrhea, TMI,
Oh my
but I
God.
did. Like, dude, my stomach would go crazy.
Yeah,
like,
anxiety,
I didn't want to eat anything. I didn't have breakfast. Mom's like, you need to eat. You can't think. I'm like, I can't eat. I have no appetite. I can't eat. Like, I was so nervous. And then all for what? For nothing, because I did great.
You did
but
good, yeah, you
I
smashed
didn't
it.
know I was gonna do great. I get test anxiety. That day, or like before, if I didn't, that was like the only time that I was like dying.
Oh, really?
I couldn't, yeah.
Dang.
yeah, I think when it comes to the NCLEX, we actually know more than we think we do. Like nursing
Yeah.
school has prepared you up until this
Yeah.
point to know all the background stuff. Now it just comes to practicing those test questions so that you don't feel like it's such a shock on test day. You're like, oh, it's just another day of practicing NCLEX questions. And I found that the NCLEX was actually, for me at least, easier than UWorld. I found
Yeah,
that
I
UWorld was
know,
really
yeah.
hard.
UWorld made
That's
me
what I heard.
feel like I was dumb.
Yeah.
I was like, this is,
Yeah,
I'm
yeah.
doing so bad. And then like when I actually like took the NCLEX, like, this is a joke. I thought the questions were too easy. They were
Yeah.
so straightforward. And like NCLEX was so much easier than nursing school. Nursing school was so much like trickery. And like this was like a straightforward question. It's like, okay, which one of these answers is the right answer? And in nursing was like, all of these except, which one would you not do? Which one would the
Try to
nurse
trick you.
be advised to? No, straightforward. Very straightforward.
Wow, okay. You thought the NCLEX was straightforward?
Straightforward.
Wow, okay. How about
Yeah.
you?
I
You're the
think-
most recent one that took.
Yeah, I think for me personally, what helped with my test anxiety is preparing ahead of time. For example, I'm not a morning person, so I need to schedule it in the afternoon. So mine was at 1 o'clock, so I
that's
can
good.
sleep in, be rested, not rush, have my lunch. So I like really prepped ahead of time.
Mm-hmm.
And then I felt comfortable because I was like, I did everything that I could.
Yeah.
It is what it is at this point.
Yeah.
The day before, I studied up until like 12 o'clock. I took your advice. I
Yeah.
studied until 12 o'clock, and then I was like, I'm done. I went to hot yoga. I had a
Yeah.
smoothie, and then I chilled for the rest of the night.
Yeah.
Didn't do anything until my exam. And then when I drove to my exam, no anxiety. I was just calm.
Yeah.
I was like, it's okay, because
That's-
I relaxed the day before. I did everything that I could. I didn't rush to take my NCLEX. Like, I gave myself time that I
Yeah.
felt like I needed, and I had a study plan, and I followed it, and I got through with it. So I was like, I did everything I could. Worst case scenario, I'm just gonna take it again.
Yeah.
So I drove to my side, no anxiety. I just took it, and then I passed.
Dang.
Amazing.
At one point, you just gotta let go, right? You just gotta be like, I know what I know, bro.
2
like what
days
you said.
before, I was
You know what it
freaking
is.
out. I was
Yeah.
like, oh my God, I'm gonna fail. I can't breathe, I'm having anxiety.
That-
But the day
yes.
before, I was like, we're done. This
That's
is
why I say-
it. Went to yoga,
Yeah.
and then I was like, it is.
I couldn't even drive. Like, you know how you drive yourself?
my
I couldn't
God.
even drive. I was like, you guys, I was like really stressed. I don't know what I was going through. I made my mom drive me.
Oh.
So my mom drove me, and like it was far from my house
How
too.
far do you think?
It was like 45, 50 minutes
Oh,
because
snap.
I took it in 2019 before COVID, before anything,
Okay.
and I was going on a trip to Europe with my family. So I was like, I need to take it before Christmas. I need to take it before Christmas. The only day they had was like December 19th at that super far location. So I was like, okay, I have to do it. That's it. That's the only day I have. So I went and I drove to take it, and she's like, oh, do you want me to go with you? It's far. I'm like, yeah. What if I'm like crying? What if I know I fail? Like, yeah, come with me. So she drove me, and then it was far from my house. So she's like, let me stay in the area. So she like dropped me off and like went to the mall to go shopping, and like. By the time she got to the mall and was like mid buying something, I called her. I'm like, I'm done.
Yeah.
What? She thought something happened. She's like, something happened. I'm like, no, I'm done. She's like, what do you mean you're done? It's been like 40 minutes, like 35, 40 minutes. I'm like, yeah, I'm done. She's like, that's too fast. Are you sure? I'm like, yeah. It was easy. And like, and then she just came back. Yeah.
Do you guys do the Pearson VUE
Yes.
trick? Or-
I did.
What?
I
Yeah, I did. Like,
Really?
you try to pay for the test again?
Yeah.
Yeah.
Did it work or no?
It worked.
worked.
It told me.
Mine
It didn't
worked
let
too.
me. Yeah, that trick. Like, you go to. You should tell.
And I
do
paid
people
to
know
get the
about this?
result like the next
Like
day.
next day.
I didn't.
But I took mine on a Friday. So if you take it on a Friday, you have to wait until Monday.
Oh,
that's
okay.
So it sucks. So don't take it on a Friday.
A little side note, if you guys don't know where the Pearson VUE trick is, if you're taking the NCLEX, apparently there's a trick. Right after you take the NCLEX, you'll get your unofficial results in 48 hours. But then there's a trick, it's called the Pearson VUE trick. So if you go and register and then try to pay for it, you can put all your information in and click schedule your exam, but it won't take money out of your account, or they won't charge you for it. Is that
Like
correct?
an error message.
Error message, that's
Yeah.
what it
Pass.
is. If you pass. If you didn't, it'll
It's
charge
gonna
you.
charge you.
It's gonna schedule you.
Oh,
Yeah.
you guys
And
probably
you'll
Google
get
this.
charged. And it's like, I think it's like pretty bulletproof because like
Everyone
Yeah,
I've asked,
everyone.
yeah,
it's worked.
I know somebody who didn't pass and they took the money
Yeah.
out of their account. I know.
Oh,
When you
And
Google
then,
it,
yeah.
Google tells you 99%
yeah.
being
It's
correct.
accurate.
I'm pretty
So
Yeah.
Another thing that actually helped me before going into the NCLEX was I looked up my program's pass rate. And it was like
okay.
96% pass rate. So
Okay.
that kind of put my mind at ease. I'm like, okay, if 96 people, or 96%, sorry, have passed the NCLEX like year after year
Yeah.
in my program, I'm like, the odds of me passing are really high. So it kind of just made me a little less stressed.
You can be in the
out.
4%, you know.
I
No,
know.
I'm just kidding. I'm joking.
I was
I'm
hoping
kidding.
not, but
Okay, so how many weeks do you guys prepare for? I recommend 4 to 6 weeks. So has it been different from you guys?
I did that. I did like 4 weeks.
Okay. How many questions overall, or do you guys do questions? Or?
I did all the questions in
Yeah,
UWorld.
I did all
all
the
the questions. I did all the
Okay.
questions.
Just
I
one
split it up.
question bank? Just UWorld or multiple sources?
I just use UWorld, but I organize it into systems. So let's say for
okay.
this week, I was just doing all of the OB questions. Next week was all adult cardiology. And I
Okay,
kind of organize it like that because then it helped me connect topics.
Okay.
Like when I was reading over the rationales, I'm like, oh, this makes sense because yesterday I was reading over this rationale with the cardiology, and so this answer makes
That
sense
makes sense,
to me, right?
yeah. Keep it cohesive, yeah.
And like I kind of just made it like part of my everyday routine. Like instead of like back then there was no TikToks, I wouldn't get distracted. But instead of like being on Instagram and scrolling, I would like open my little like UWorld app and I would like be tanning and like doing practice questions.
Okay.
Like I would just do them anywhere because
Nice,
like if
yeah.
I'm like waiting in line for like my car to get washed, I'll do that. Like I'll do it anywhere, and then I would just give myself a goal. Like okay, today I have to do 200 questions, or today I have to do 100 questions. So let me do 50 in the morning, take a break, do my workout, whatever. I'll do 50 in the afternoon, and like that. And I did it by systems for 3 weeks, and then the week before my test, I did like the shuffle mode, and it'll basically be like a
random
like an NCLEX, because
Yeah.
like number 1 will be OB, number 2 will be mental health, number 3 will be peds, like, and that's how the NCLEX is.
Yeah, exactly.
Yeah.
You know, shuffle.
Very true, yeah.
I did the same thing.
Yes.
I studied for a little bit longer though. I gave myself a month and a half to 2 months. So I spread out the questions a little bit more, but then that gave me 1 day a week or 1 to 2 days a week off to just kind of
just decompress
and relax. But
I always tell students, pace yourself. It's like kind of like a short sprint marathon in a sense.
Yeah.
And then the week of the NCLEX, you should have like at least 2 days of just spa day, beach day, movies,
Or just
something fun.
give your brain a break.
Relax.
Yeah, because either you know it or you don't know it, right?
Yeah,
So, yeah.
Like, there's no way around it.
All right, so very juicy interview question here, and I'm reading. As you guys know, Congress is capping nursing pay. Pharmaceutical companies, it's Wild West, they can seemingly charge whatever they want for medications, big money, right? Even with critical meds like insulin, epinephrine, without Congress getting involved. How do you feel about Congress now capping hero pay, or basically nursing pay?
To my knowledge, I believe that they're actually capping agency pay and not travel nurse pay. So it will affect travel nurses. However, like we said earlier, agency will be charging $10K and giving $5K to the nurses.
Oh, wow.
So they want to cap how much agencies can take home.
Okay, that makes sense.
That will affect travel nurse pay. So for example, if the agency now is making $5K, they'll give you $3K instead.
Okay.
So it does affect travel nurses, but it's mainly made
The purpose is for
the agencies.
Yeah.
However, that will affect us
Yeah.
too, because they still want money. You know, at the end of the day, it's all about money.
Makes
But I don't
sense.
necessarily agree with it, because I believe nurses deserve better pay.
Yeah.
They wouldn't have to go out of state and go through so much just to make money.
Right.
If you just paid us the amount that we deserve.
Yeah.
It's priceless. Like
Who's gonna do
the
it?
amount of work that
Yes.
we do, it's priceless, and it's more than just like, we're not like robots. Like, you don't just read a textbook and show up to work and do all the basic things. It's like the human interaction that we give people, and like being caring, and like that's what helps the patient heal the most. And like I saw that when I was working in COVID. I remember I had a patient that their daughter was a nurse, and she worked in the floor above, and every day she came to see her dad at the end of the shift, and like, you know, like bathed him, did everything, and like she was like, no, I'll do it, like I'm a nurse. And she's like, okay. We're like, no, I can help. She's like, no, I'll do it. And like her dad did so well. He was like, he got discharged way faster than everybody else, and it was like, honestly, like the care that she gave her dad, like the love and the care. Because imagine, like, during those times you're alone in a room by yourself. That's not good for your mental health.
Yeah.
Like, if you're not healing well and you're just like depressed all the time, that's gonna affect you completely. Like, you know, when, like, at least when I got really stressed out in nursing school, I got sick so many times, got like stomach problems, like GI issues.
Hazard pay, yeah.
Of course. So like when you're there and like you have somebody caring for you and treating you better, and like that's the work that you do as a nurse, that is invaluable. Like, I don't understand why they would try to cap our pay for what we do.
So this comes on the heels of nursing having to show up at the front lines, not having PPE, not having N95 masks, huge hazardous pay. There's been nurses that actually died of COVID, right?
Of course. And I feel like we were so understanding when everything went down and the hospital was like, oh, there's no mask, so you have to reuse your same N95 for 4 days.
No one quit.
No one
well,
quit.
Maybe some, but not a lot of them.
I mean, I didn't. I was very understanding.
Yeah.
And like, I like in those trying times, I did my job, and like now it's your turn to pay up, and like you don't want to.
Yeah.
That's not cool.
But it's very like Toss said, it's kind of you know, maybe some addendums inside their policy make, but I did see something where it's like no travel nurse should make over $100 an hour. And there's like a cap, and I'm not sure if that's agency. I'm not sure if it's that.
I didn't see
there's
that,
a lot of
I don't
stuff
agree
in
with that because at the end of the day, would you cap someone who's taking care of you in your last moments? It's life-saving. We're the ones who see the first changes. We're the ones who advocate for you. We're the ones who are providing the care. Like, we can tell when something goes wrong, and that can be life-saving. And then if there's no nurses, who's gonna do that?
Right.
Is your life worth more than paying a nurse more than $100 an hour? Is it? Like, you wouldn't want that for yourself or your loved ones. So why treat nurses like that? We're not just nurses. We're also techs. We're also assistants. We call people. If it's a COVID
therapists.
patient, we're the ones always in the room. No one else goes in. Like, our social workers don't go in. We do it. If we have people bringing in food, we take it in. We're first people to get exposed to everything.
Yeah.
You know, there's also nurse abuse. Like, we have patients who do everything.
Being
you know, I got
combative.
kicked by a patient the other day.
What?
Yeah, and there was like, and then I had to like get help, everyone run in and like help me restrain the patient. But like, what about that? Do you get, like, you know, there's jobs, people work from home, comfort of their own home, and they get paid so much more than nurses. And our job is like really demanding. It's life-changing, and you're capping our pay, but what about all the other industries?
It's so funny because I heard the other influencer, Mickey, and she was talking about like, look at the tech industry. They could get paid $150,000 a year or whatever it is. at home working on the computer.
But no one wants to keep
And
their
no
pay.
one's kept their pay.
But we're saving lives,
Yeah.
and we're putting our life at risk, and you are worried about our pay.
Or even like
How about let's focus on keeping staff by providing safe patient to nurse ratio. Let's focus on that. Let's focus on providing proper PPE. Like, let's put our energy towards something else and not just focusing on our pay, because that's not going to solve the issue.
Sure.
like the answer is like so simple that it
Yes.
blows my mind that they just like try to go around it, like beat around the bus as much as they can. Like if you just pay us more, you don't have to get travel nurses.
Yeah, and they could have done this whole time.
They could have done this up front
yeah.
when it first happened. And my hospital had lost so many nurses, like the first wave, that like that's why they put the $750 and the $15 an hour. And then after a few months, they took it away. The second time that they brought it back and took it away, I was like, well, I'm out of here.
Yeah.
I was staying because of that, but like obviously you guys don't value us enough to keep it. Like there should have been at least a retention bonus.
Yeah.
Like if I stayed here when I could have left and been a traveler with the experience that I have, you should have paid me at least 10 or 20K, not giving it to me up front if you didn't have to, in lump sums for retaining, like for staying here, because I could be making more money, and they didn't even do that.
And it's so funny because people will be like, oh, well, then our nurse is being greedy. But at the same time, this is a high hazardous job. Are you going to go into someone else's room face to face with someone who's COVID positive without
And
a
like,
mask?
and like besides that, like there's like a huge inflation right now, like a 20% inflation.
Right, yeah.
How am I supposed to like buy a house when everything went up and I'm still making the same amount of money and I've been exposed and I've been like totally screwed over in this situation?
And not even buying a house, like as a new
Anything,
grad,
yeah.
we don't even get paid that much. And I was
Yeah.
asking people in my cohort, I was like, how are you paying rent? And they're like, because you're not allowed to pick up shifts like as a new grad until a certain, like after
Yeah.
you reach a certain limit. And they literally were like, we don't eat out. And like we budget insanely, and like
Jeez.
we can't even afford to do anything. And we're the first people being exposed to everything.
And you're out on the front line. And the funny thing is that the hospitals have the resources and then get government fundings most times.
Yeah.
And it's just, they're not, given out to the actual frontline workers. And that's the,
Yeah.
it stinks. Message your Congress today, working to make a change. No.
Yes.
Actually, Nurse
Yes, we
Blake had
should.
a Congress thing, right? Change.org.
Yeah. I put it on my bio and I did sign it.
We'll probably put the link in if it's still active, yeah. So.
Yeah.
I think it might
cool.
be, yeah.
All right, guys, that wraps it up. Thank you so much for watching. And remember, don't be scared, be prepared.